So the budgets of these agencies have been deeply constrained in order to finance the exorbitant $884 billion military budget. And it will not be possible to provide the programs needed to protect our citizenry from current and future threats to health without cutting weapons spending, particularly nuclear weapons spending, both the most expensive and the most dangerous. And so this forum explores these budget choices. Now, chairing our opening panel is Mass
Hey,
State.
Jonathan, I'm going to jump in. We're a little asynchronized, and some people, I think, missed your remarks, and I didn't get them on the live stream. Would you mind saying that over again?
Me? No, I'm always happy. I will say those over again. I apologize to those of you who already hear it. So
Thank you, an apology for the mistake.
I was welcome to this forum. Thank you for attending. And I commented that the deaths of millions from more than 1 million Americans from COVID-19 has made us sharply aware of the importance of healthcare and the requirements in our privatized system of health insurance to finance it. In June, we had a Fund Healthcare Not Warfare Forum, which explored the failings of the healthcare system in some depth. But it's not always recognized that prevention of disease, including diagnostics, vaccines, and therapies, they're not financed through Medicare, not through Medicaid, not through private health insurance, not through hospitals. They depend on the budgets of the National Institutes of Health, National Science Foundation, Centers for Disease Control. Those budgets are appropriated each year by the Congress. They're not entitlement programs like Medicare or Social Security. You know, once you're sick, yes, then you desperately need health insurance. But what we need is to not, to prevent people getting sick in the first place. So for years and years, the budgets of these agencies have been deeply constrained in order to finance the exorbitant $884 billion military budget. And it won't be possible, it hasn't been possible, and it won't be possible in the future to protect our citizens from current and future health threats without cutting weapons spending, particularly nuclear weapons, both the most expensive and most dangerous. And this forum explores these budget choices. I can tell you that we never, in conferences on biomedical research, many of which I've chaired, are allowed to talk about things like the military budget. And generally, when we talk about nuclear weapons, we don't talk about the fact that it's also undermining long-term health. So we're starting what I hope will be an annual tradition, or maybe biannual. Anyway, chairing our opening panel is Mass State Representative Carol Doherty. Carol is the former president of the 100,000-member Mass Teachers Association, sponsor of a number of bills in the state legislature that address the federal and state budgets. Carol, take it away.
Well, thank you very much, Jonathan. And it's always a pleasure for me to be invited to participate in these important conversations. So thank you again. The title of panel one is the Congressional Discretionary Budget. Just a few rules to define our work for the next 45 minutes or so. I will make a few brief remarks about the proceedings, introduce each panelist. Each panelist, after the introduction of all of them, will have 8 minutes to present. Some of the panelists will be using slides to enhance their presentation. Each presentation will be followed by an open 4 minutes for the audience, if you will, to ask questions if they so choose. If you want to ask a question, use the raise hand function, and it's under reactions if you're not accustomed to that. So you just click on reactions and there'll be several little icons or emojis, I guess. The raise hand function is what you want to use, and I will try my darndest to keep track of the order in which people request to ask a question or to make a comment. For me, I have been a long time, or had been a long time, activist in the Jobs with Peace campaign for many years, particularly when I was president of the Massachusetts Teachers Association. Our effort at that time was books, not bombs, but we focused in the same way that we are focusing now on the congressional budget. And you very well know that the congressional budget, the state budget, even local budgets are always a reflection of our commitment to the citizenry, and our various constituents across our communities, across the Commonwealth, across the country, and so that we are sure, if we know what that congressional budget looks like, that our wants and needs and the wants and needs of the citizenry are met in the many ways that Jonathan has described. And so without further ado, I'm going to go through the list of presenters. I think everyone is here, Debbie, Lindsay, and Shelley. We might be missing Larry Cohen. He may be somewhere else in the mix of participants. Let me introduce the people who are here. First, Debbie Weinstein, longtime executive director of the National Coalition for Human Needs, well-known authority on the congressional budget. Our second presenter will be Lindsay Koshgarian of the Institute for Policy Studies, author of the National Priorities Project pie charts, so useful to many of us, and Sally Gupta Barnes, the National Policy Director of the Poor People's Campaign. I remember that from my jobs with peace work, and lead author of their moral budget. And when Larry comes in, if he's able to do so, we certainly will introduce him as well. So in the order in which I introduced you, would you start, Debbie? You have 8 minutes, enhanced by some slides, as I understand. So take it away.
Thank you very much. I very much appreciate this opportunity. And I will share my screen. If I can go back to finding. Here we go. So these are my mystery numbers, which I will try to reveal these mysteries. Failing our future, I have to say we're not doing so great on our present either. But what I want to do is illustrate some of the very large range of domestic programs that we depend on, and we are not seeing our needs met now in the what's called the domestic discretionary area. So as we're taking on, as Jonathan was laying out for us, it's not such a very large part of the overall federal budget, but it does account for a lot of areas. So what are some of these? This 2 out of 3, that's children under the age of 6, where all the parents in the household are in the labor force. But on the right-hand side, if we allow childcare funding to plummet as it is about to, and this is discretionary money, 1 out of 3 childcare centers could close in the US, affecting 3 million children. That would be one way of failing our future. From 10 to 15%, what does that refer to? Well, 2 years ago, when people were asked, people with children in this example, were asked if they sometimes or often didn't have enough to eat in the previous week, 10% said yes. But just this past month, 15% said yes. And then if you look in racial breakdowns, 1 in 5 Black respondents said that they sometimes or often didn't have enough to eat. 1 in 6 Hispanic or Latino, 1 in 10 white people responding. So that shows this distinction. But for all, it's shameful that in a nation as rich as ours, there would be so many people going without food. So on the right-hand side, that's 700 to 800,000. That is infants, toddlers, pregnant and postpartum moms who would be turned away from the WIC program, Women, Infant, and Children Nutrition Program, if Congress does not increase the funds. Be the first time in more than 25 years that we haven't served every eligible young kid and mom. What's that 49,000? Well, a year ago, that was the teacher shortage, and that was up 35% from the year before. On the other side, what does that 224,000 mean? That's the number of teachers who would be forced to be laid off if the level of cuts that the House has proposed in K through 12 education aimed at low-income communities. They would make a 14.7 billion or 80% cut. So that's what we're talking about in terms of our priorities. Let me get to the next slide. Wrong priorities. This shows you where things are comparing defense and what's sometimes called non-defense, but that always seems terribly negative phrasing to me. So the domestic and international peace related funding. Last year, we had more money spent on defense than those domestic and other areas. You can see that. There was a deal passed to constrain spending, and that was the price, as you may remember, of the debt limit being raised so we wouldn't have economic catastrophe. Well, they allowed for a considerable increase in defense, that 886 billion, and the domestic goes down. They had some workarounds for that, but the House is now not abiding with those workarounds, and they are making those cuts such as I've described. And it would get worse the year after. Well, so those give you some small examples of the number of cuts to give you a little more of a sense of the extremely wrong priorities on the House side, especially. 51,000 kids cut out of Head Start, totally eliminating the federal work-study program. Let's see, totally eliminating youth job training and adult job training through a particular major program for that, despite being told all the time about the worker shortages that we have. And more examples, National Institutes of Health. Of course, we include that, but I just want you to see the full range or some of the range. NIH cut 2.8 billion below the current year's level. There are cuts in environmental programs that go against the tremendous achievements that were made to start to reduce greenhouse gases and to particularly focus on the disproportionate needs in low-income communities. They would cut those things. They would cut the Centers for Disease Control, eliminating funding for ending the HIV epidemic. Let's see, we've got dramatic problems with substance abuse and mental health, as you know, and yet the House would cut that funding below the enacted level. So those are just some of the examples of the extent to which our priorities are wrong. As you learn more about areas where you can make cuts, and this sub part of the defense picture that we'll be hearing about today, just be aware how extremely serious these problems are, and where we have to right our currently wrong priorids.
Yeah, but you're coming up on 30 seconds.
Yep, and I'm ending. I'd like to invite you, if you're not already subscribers at chn.org, please click on subscribe at chn.org. And if you go to that website and you click on the Take Action button, you can right now tell your senators who will be voting this very week upcoming on the levels of funding for the WIC nutrition program. You don't need to bother with all of that URL there. Click on the Take Action button and you'll be able to send a letter. Join these more than 6,000 people who've done it so far. We need you to fight for the right priorities. So that just gives an overview. Thanks, Carol, and thanks everyone for this opportunity.
Thank you very much. And the slides do enhance the presentation, so thank you for preparing them. So we have 4 minutes following Deb's presentation for our audience to pose questions. If you would use the reactions button and put your hand up. If there are no questions, I'll wait. I shouldn't be in a hurry. I should wait patiently. All right, this will give us an opportunity to go on to the next presenter. And you may be kind of thinking about questions that you might ask, and we certainly, time permitting, at the end of the panel presentations, ask you to ask questions at that particular time. So our next panelist will be Lindsay Kashgarian.
Thanks, Carol, and thanks to Mass Peaks Action and Jonathan and Cole and the rest of you for hosting this today. And thank you so much, Debbie, for that really horrifying picture of what the House of Representatives right now is poised to do. So I also have some slides I'm going to share, so I'm going to get started on that. And
we see him.
Are you seeing that?
Yeah.
Yes.
Great. Okay. So Debbie talked about what's at stake in right now the budget process that Congress is going through on the domestic side and all the social programs that people depend on. I'm here to talk about what they're doing on the military side. And right now we are on our way to $1 trillion military budget. And I just saw in the chat, someone mentioned that total spending on what you would call, we call it militarism. They call it security. We know it's not security. Total spending on that is already over $1 trillion, but I'm talking about just military spending here. So we are on our way to $1 trillion military budget, just military. That includes the Pentagon, or the Department of Defense. It includes nuclear weapons at the Department of Energy, and it includes some other intelligence spending. It's a relatively small part of it. But this is a higher budget than what we had at the height of we're now getting up to where we were at the height of the 9/11 wars. It's higher than the height of the Reagan era, as you can see in this chart. It is even higher than it was at the height of the Vietnam War or the Korean War, which isn't on this graph, but those things are also true. The last time military spending was as high as this was at the height of World War II. And as you all know, we are not in World War III, and we do not need to be spending on the military as if we are. So this next chart just makes a point that Debbie already made, which is that the deal that Congress has struck, and there are supposed to be workarounds to this, but the House of Representatives is really trying to throw a wrench in the works on that. So the deal that was legislated, that Congress signed and that Congress passed and President Biden signed earlier this year for the spending for the coming fiscal year, would give a boost to military spending, and it would take a cut from domestic spending. And that's really important because that's all we have guaranteed right now. If Congress doesn't do what the deal that was the handshake backroom deal that they agreed to bring that domestic military spending up, this is what will happen. Now, here's a table showing you what is currently working its way through the House and Senate on military spending. So these are military spending amounts that have worked their way through various committees. For the most part, it's the House Armed Services and Senate Armed Services committees as part of the National Defense Authorization Act. And that's the piece of legislation that covers military spending every year. There are also things working their way through the relevant appropriations committees. So there are these sort of parallel tracks. But these are some of the numbers that have already been passed by the House and Senate this year on military spending. And so you'll see the totals. First of all, the House and Senate, despite being in Republican hands and Democratic hands, on the numbers, they're very similar. There are some big differences in terms of military policy. The House bill includes, and I need to give a shout out to this, the House bill includes lots of really atrocious policy changes for the Department of Defense, things that would strip medical funding for trans service members, for abortion services. It would strip funding for for essentially all diversity programs in the military, including just things as simple as anti-harassment programs and anti-discrimination programs, and programs that are intended to ferret out white supremacy in the military, which is a real problem among service members. So the House version includes all kinds of things that you can't see here just from the numbers. And so there are important differences. And going forward, that is going to be a big part of what the House and Senate are fighting over when they try to eventually actually pass these budgets. But we need to both be on the right side of that and also keep calling their attention back to the numbers, because this is a huge amount of money and it is desperately needed elsewhere. So as you can see, the numbers are very similar between the House and Senate. Both of them have a total military spending of $886. Actually, I'm sorry, the Senate has a typo there. They're both $32 billion. I'll send a version of the slides out with that corrected. They're both $32 billion for nuclear weapons. So very, very similar budgets, huge amounts of money. These are record-breaking amounts of money for both. And within that first line, the biggest Pentagon line, that also includes about $37 billion in both the House and Senate budget for nuclear weapons delivery systems. So those are the planes and the submarines that are in the Department of Defense. And that includes things like the ground-based strategic deterrent, which is the replacement for the intercontinental ballistic missile. It includes things like the Columbia-class ballistic missile submarine, the B-21 bomber, that's a nuclear bomber. So all of those programs are actually part of the Department of Defense. And so when you put those together, you're looking at about $70 billion that is for nuclear weapons in this budget. And the Congressional Budget Office recently put out a report showing that nuclear spending over the next 10 years will total $756 billion. And just to compare, that's about more than twice what the initial estimates were for clean energy investments under the Inflation Reduction Act. So that is, the Biden administration's signature piece of legislation. Their initial estimates were that clean energy investments under that act would be $369 billion. Nuclear spending and that's over the next 10 years as well. Nuclear spending over the next 10 years will be twice that. So we are looking at severely skewed priorities here. And finally, I just want to point out that at National Priorities Project, what we're all about is what happens when you shift these budgets around, and how many of Debbie's priorities could we pay for if we took some of this money out of the military pot and put it into the domestic pot. And at our website, www.nationalpriorities.org, we have a calculator that you can use to find out if you took money from certain military priorities and reallocated it to domestic priorities, what could we get? And so here I have an example. This year,
you have 1 minute, Lindsay.
Okay, thank you. This year in fiscal year 2023, the United States spent $31.5 billion on nuclear weapons. That could have hired 380 registered nurses. Debbie talked about the school teacher shortage. It could have hired 344,000 school teachers. So we're talking about really huge amounts of money that can make a really huge difference if we change where we're putting them. And so I don't have a petition for you right now, but what we know is that we're in danger that Congress could raise this military spending even higher. They're most likely to do so through a Ukraine supplemental spending, which they will do, but we need to make sure that that money only goes to Ukraine and doesn't end up coming back for the Pentagon. So what you need to do is please ask your member of Congress, tell them to hold the line on military spending, no more money for the military budget this year. Thanks.
Thank you. Thank you very much, Lindsay. Those are frightening. Not a frightening presentation in the presentation sense, but the statistics are deadening. So we have 4 minutes to put some questions to Lindsay. Use your raise hand function if you wish to ask a question. People are saving their question. Jonathan has a question.
Lindsay, does this go to a conference, House Senate conference committee, which, operates in kind of secret for the final kind of thing?
Yeah, so the NDAA typically doesn't go through the formal conference procedure. That deal usually happens behind closed doors. What we were told is that the House and Senate each passed their versions of this over the summer. And what we've heard is that staffers had agreed to actually basically put it down for the time being. And so they're only now picking it up again, which means that staffers will be starting to, behind closed doors, discuss how to hash out the differences between the House and Senate bills. So that process is just barely picking up again now. Of course, officially, they only have until the NDAA doesn't have to happen to keep the government open, but the appropriations, some kind of appropriation does, and they only have until October 1st to work something out in order to keep the government open. I'll just once again note the big differences between the House and Senate here were on policy matters, things about funding for trans service members or abortion or diversity programs. The big differences were not on dollars. So there will be some things that they have to work out behind closed doors on the dollars. But for the most part, we can expect it to look pretty much like what they have here because the House and Senate were already so close together.
Thank you.
Thank you for that. We have a hand, Bruce Burdick.
Yes, I'm interested in what the military budget would be if we were to end the global warming and climate change. I could give you an estimate. You can tell how many pounds of CO2 are emitted by dividing the per capita CO2 emissions of the US by the per capita gross domestic product. And every dollar spent in the US emits about 0.6 pounds of CO2. To end the global warming, we can't emit any CO2. So this military budget would have to be zero to end the global warming. It might be a new argument to say our goal needs to be to end the global warming. We need to end this military budget that is emitting so much CO2.
Yeah, thank you for that comment. A couple things about that. One was that we know that the military is the largest the US military is the largest single emitter of fossil fuel emissions in the world. So that's it's a significant contributor to the problem. Another thing, there was a study a couple of years back that estimated that out of the military budget, about $80 billion every year goes toward protecting fossil fuel interests. So there's a big relationship between the military and military activities and fossil fuel emissions, and that's something that we're actually preparing. There's an anti-militarism presence that'll be at the New York Climate Week March on September 17th, and we're preparing for that right now.
Thank you. Thank you very much.
Thank
Peter,
you.
Thank you. Peter Bertle. Peter?
Yeah, thank you. It's Virgil. The idea that this is a defense budget implies that it should be defending us against things that are threatening us. And to follow up on the last question, that's climate change is one of the biggest threats. So is there any prospect at all for trying to frame the military budget as a way to combat or mitigate climate change?
Yeah, thank you for that question. We could have an entire webinar just on that, but I'll just say I think it's a dangerous territory because the military itself is actually military leadership has recognized climate change as a threat, but their solutions look a lot different from probably what your solutions or my solutions would look like. They want to spend a lot of money on things like shoring up naval bases that are at risk from sea level change and preparing for climate-driven conflict. And preparing for them, of course, means more investment in weapons, more investment in more military presence around the world. So it's a very tricky topic, and we do have some work that we're doing around that. But again, I think it would probably take more time than we have to get meaningfully into that.
Thank you very much, Peter, for that question, and for Lindsay for responding to all of the questions. We're at the end of the 4-minute period of Q&A for you. I will let the audience know that Larry Cohen, our fourth presenter, is with us somewhere here, and he is the president of the Communication Workers of America and chair of National Our Revolution. I'm interested in that. And so we're going to go on to our third presenter, Sally Gupta Barnes. We see you.
Okay, great. Can you hear me?
Yes, we can.
Wonderful. Thank you to everyone who is here for this conversation. It is, it is critical to the health and safety of our nation that these kind of conversations are happening more and more often among both seasoned and new, people who have been talking about these issues for a long time, as well as people who haven't been, because many of us are awakening to this reality that just simply doesn't work for too many people. And so my role on this panel is to speak to the social costs of the war economy, which are significant. And some of you may be familiar with Reverend Dr. Martin Luther King Jr. speaking to those costs in his 1967 Beyond Vietnam sermon, when he cautioned that a nation that continues year after year to spend more money on military defense and on programs of social uplift is approaching spiritual death. And he wasn't just concerned with the budget priorities of the nation. He saw that war, in its most essential sense, devalues human life. And today, what he might say also is that it devalues, the life of our planet and our resources. And at that time, he continued, if you treat human beings as a means to an end, you thingify those human beings. And if you thingify persons, you'll exploit them economically. So as he's tracing the social costs of what was at that time a growing war economy, still growing, and what they reveal about the values of our society, recognizing the extent of those costs, what they meant about our values, he launched the last campaign of his life to connect those injustices, the triple evils of militarism, of racism, and of poverty or economic exploitation in the Poor People's Campaign. Because the best way, the only way that he saw, and I believe the only way we can, take on the evil of militarism today, is to address also the racism and poverty, and now a climate crisis, and to build on the leadership of those who are facing all of these crises at the same time, who have the most at stake in changing these death-dealing systems to save their own lives and all of our lives, in fact. So more than, I think, as we all know, more than 50 years later, all of these injustices, all of these evils have only become worse. And this is in part because as a nation, we have not, as we've heard, we have in fact prioritized systems of violence, war, oppression, and death, rather than systems of healing, of repair, of abundance and life. And so today, we're facing a population of poor and low-income people that is much, much greater than most of us are aware of. It's 112 million people in the country. That's 1/3 of the country are poor or one emergency away from being poor. These 112 million people live in every region, state, and county of the nation. And yet this widespread crisis is going more or less unaddressed because the political will, the political resolve needed to deal with that widespread injustice is being sapped up by these demands of a war economy, which, as we saw from Lindsay, has more or less kind of united support. And in fact, we were in front of a member of the House Budget Committee in 2019 said that joining the military was the best anti-poverty program we had. Although I think, as we might know, there's widespread food insecurity among military families. It was not doing a good job of addressing the hunger crisis that Debbie told about, or really, and it's cruel and inhumane to force people into war and violence, for healthcare, for a chance at a decent education. And so, to be clear, these costs do not remain among the poor. We as a society suffer when there is such widespread abandonment amidst abundance. So during the pandemic, during the deadliest phases of the pandemic, poor counties had death rates that were 3 to 5 times higher than wealthier counties. And these were discrepancies that could not be explained by variations in vaccination rates. And as we saw, policies to secure housing, healthcare, water, childcare, paid leave were implemented because such great numbers of people did not have access to those basic needs. And that was a health risk, not only to themselves, but to the nation as a whole. And new research from UC Riverside has shown that poverty is the 4th leading cause of death in the US, causing more deaths in homicide, more deaths in suicide, more deaths in gun violence, overdoses, even diabetes, taking up to 800 lives a day. And as someone noted in the chat, there has been a decline in life expectancy because of these misguided priorities. And the biggest declines have been in the poorest states in the country, Mississippi and West Virginia, with 2 very different demographics, but what they share in common is their poverty. So the social cost of a country that tolerates 800 deaths a day from poverty means that, in fact, none of us have a safety net that we can rely on in a time of crisis. The promise of the founding documents of the United States are more like privileges to the few. If you have the right kind of job or on the right kind of income and live in a place with the right kind of infrastructure and investment, which fewer and fewer of us actually do, unless all of those factors line up, we have no right to housing, no right to healthcare, no right to water, no right to clean air, or a right to a decent job or a living. We are essentially on our own. And war is certainly not the answer, and neither is joining the military, but we know what is, right? We know the policies to expand and protect, to provide childcare, food security programs, universal healthcare, building up the kind of infrastructure that we need so we can all have clean drinking water, clean air, safe communities, good jobs that pay well. And of course, to better understand the relationship between all of this, more rigorous research on the impact, the long-term impact and relationship between poverty and public health. These are the answers so that we can diagnose and treat this problem effectively, a problem facing 1/3 to 40% of the nation who are unnecessarily suffering because we do not have enough to live. I will never forget, and I'm wrapping up, I will never forget in 2019, when the Poor People's Campaign organized a presidential forum in Washington, D.C. with now President Biden, now Vice President Harris, Senator Warren, Senator Sanders, all the big names were on the ticket that year. And an elementary school student from Massachusetts asked one of them, I think she asked Senator Warren this question: what are you going to do about the fact that there are needles on my school playground? What are you going to do about the fact that I am not safe in my community? And I think this is the kind of question we need to ask ourselves, because there's too much on the line for our families, for our communities, for the nation that we have yet to be. And it's on all of us, everyone here and everyone that we know, to take this up now, to take it up in 2024, however long it needs to take to get there. And I'm convinced that we can and that we will. So thank you. Thank you, everybody.
Thank you so much for that heartfelt presentation. I took careful note so that when I'm making presentations about working people and supporting working families, the heartfelt presentation that you have just made, that data, those statistics are really drives the message home. I think I'd like to know what the statistics are here in Massachusetts in the same way. So 4 minutes for a question. Anyone has a question?
So just on that note, Carol, we do have the Poor People's Campaign released a set of national fact sheets. IPS worked with us on those as well, and so we do have a fact sheet for Massachusetts that lays out many of those numbers, and so I can share that. I can share those resources in the chat soon.
Great, thank you so much. I appreciate that. Questions? Anyone? Jonathan, do you have a question?
No, I just want to, not everybody may know that the Poor People's Campaign is organized state by state. And, these webinars reach a national audience. So just be aware, if you're in whatever state you're in, you can find the Poor People's Campaign there. Of course, there are Peace Action affiliates, Our Revolution affiliates in most states. And, we think that it's important for these folks to link up locally and start with where they're at. And that has been, a kind of goal. It's been hard to move on, but in the next year, going into 2024, I think we have to do that. Thanks.
Thank you for that, Jonathan. Elaine?
Hi, I have a question that probably we really can't answer, which is, these were 3 such moving presentations. And the question that I keep thinking of is, who are we? Who are we that this is what we've become? That we keep making these weapons, these cruel, horrifying weapons, while not serving people who are poor, not serving school children, not serving teachers. It's really so painful. How did this come about, that this is what we are as a nation? Aristotle says that a good government is a government that makes its people care to be just. And our population has lost the aspiration to be just, or these kind of figures that all of you are describing would not be acceptable. There would be a mass movement not to ask just for global zero and nuclear weapons, but global zero in the military altogether. What does it matter if we can win a war if we're going to lose our planet? And in the vanguard of that loss will be all these little school children and all these poor people in Mississippi and West Virginia. It's really, as the quotation from Martin Luther King said, this is a country that has lost its soul.
I really appreciate that, Elaine, and have to say that I think, in fact, there is a lot of really amazing work that people are kind of compelled to do. We saw this during the pandemic, right? These little, at a community-based level, there were food drives and food exchanges and childcare, just assistance cropping up out of necessity. And I think what we've lost is the institutional and public meaning governmental, right? Support and political will to sustain those kind of programs in the long run. Instead, all of them are being slashed. They were necessary before the pandemic. The pandemic gave a reason to kind of bump up what we currently had, but now all of those supports are gone, and what we mainly have is support for war. And so it's a really people out of necessity for their lives are doing this work, and it's going unnoticed and unfunded. And because it's isolated and disconnected, it cannot kind of emerge. But I appreciate this call for what you're calling for is a broader movement. And what I kind of firmly believe it's got to be kind of held community by community, and then kind of from the ground up, build that groundswell for really shifting the whole direction of this country.
Thank you. Thank you very much for that. So we've come to the end of the 4 minutes for Sally, and we will go on to Larry Cohen, our next presenter.
Hi. Can you hear me okay?
Yeah, there you are. Welcome, Larry.
Yeah, okay.
Appreciate
so
that.
Great to be here. let me just say that in my union, CWA, I was the president for 10 years and spent most of my life there. I said frequently, it's hard, but not hopeless. So what Jonathan asked me to talk about often sounds hopeless. What is the political strategy? What are the political possibilities? How do we organize politically, not only around the military budget, and as the last speaker said, we never should call it defense, it's military. That to do that effectively, and that's where the framework of this conference, this webinar, the last one that I participated, we have to link up with others because we face political odds, meaning the combination of lobbying, electoral politics, a Democratic Party that's controlled by big money that leaves people often thinking, or at least acting, as if it's hopeless. So where is the hope? So in our revolution and in my work, even in the union, I talked about this as a triangle. And the base of the triangle is what we mostly just heard about, issues. We all do this work because of issues, whether it's a bloated military budget that threatens us all, whether it's the climate crisis that threatens us all, whether it's we spend the most on healthcare, 20% of GDP, and have horrible outcomes. Look at the death rate in COVID in the United States compared to any other country, particularly any other OECD country. We don't fund long-term care, whether it's children or elders. Workers' rights, where I spent my life, we're at the very bottom in terms of the right to organize. Look at Starbucks workers and get an agreement and move on. And that's a very complicated part of this. But when you put together those 5 things, you do have the basis of a movement that drives and can drive tens of millions of people. To put some hope in this, when I left the presidency of CWA, I didn't run again in 2015. I said to Bernie, who I knew well, okay, Bernie, I'll volunteer 10 hours a week. Let's talk about what I'll do. That became a joke because the volunteering was full-time and I was a senior part of the campaign, although by choice unpaid. And I raised that because were it not for the rules that the Democratic Party had then, and they're slightly better now because of that movement, Bernie would have won the nomination. And I don't want to dwell on that in 10 minutes, but the biggest single one was these so-called superdelegates that I've been one since 2005, not elected in the state primaries where several $1 billion is spent, billion in primaries alone. And whose money is that mostly? Had 750 delegates, 500 of whom were committed to Hillary Clinton before the Iowa caucus, meaning before the end of 2015. And those numbers would flash up on the screen. And so the good news is we were zeroed in on that, and I don't want to spend any time on it, but we created a commission. I was the co-chair that changed some of these rules and got rid of superdelegates. And then in 2020, we ran into other problems. But the point being that this triangle is fueled by issues. We often talk about elections, but the other third side of that triangle, organizing, meaning sustainable political organizing, we collectively, I don't mean the people on this call, but the movement of millions. There's 8 million people signed up in our revolution. Most of them do very little, but 100,000 of them do something. But the 8 million, what do? They vote a certain way, they get certain information, they'll vote a certain way, etc. But they don't spend any time on the political organization, whether it's our revolution or, more importantly, frankly, and we have Member McGovern speaking at the end today, and I don't want to put him on this spot, he's one of the best we have in the House. But the Democratic Party and its rules and the 57 parties, we don't have a national party, we have a DNC. The Massachusetts party that he's a key leader of is a disaster. And all you have to do is look at Rich Neal, who's the ranking member on Ways and Means. It's key in the budget process. that we just heard about for the last 45 minutes and look at his contributions and where they come from. He's not movable. And then we have, well, what is the primary process like in Massachusetts? And again, I can't dwell on any of these things here. But
You
what I
gotta
do
sum
want to
it
dwell
around.
on, what I do want to dwell on is that the political organization is key. And Jonathan particularly asked me to talk about the Congressional Progressive Caucus, so I'm going to move to that. That is very hopeful. I just want to say that we have reform elements in about 20, meaning leadership, in about 20 of the 57 parties. We had none in 2015. It's not hopeless, it's just hard. I could say it's too hard. I would say it a different way coming from North Philadelphia, but it's not hopeless. And the Congressional Progressive Caucus, to go to the hope end for a minute, it has 100 members. That's about almost half of the Democrats in the House of Representatives. That would matter. It has amazing leaders, the three top leaders, Pramila Jayapal, Frank Kassar, Ilhan Omar, and then even the next 10, all support freezing, cutting back the military budget. They all support no new round, even though, and they don't vote for it, but that doesn't matter, right? It's a protest vote. No new round of nuclear weapons. They all support Medicare for all. They all support the various versions of workers' rights that I have spent a lifetime on, most recently the PRO Act, Employee Free Choice Act before that. They all support no more drilling. They all opposed the president, voted no on Mountain Valley Pipeline, that they stuck at the only demand that Biden had. The only demand was to support Manchin and the fossil fuel industry and build the Mountain Valley Pipeline in the debt ceiling bill.
Larry, you have a minute remaining.
So the thing I want to stress here is, and the governor will be on here, he's a member, that our strategy in part has to be to elect Democrats more in primaries, fighting the incumbents. We can't just fight Trump. We have to be in these primaries, fighting the incumbents in many cases, like Neil. And there are many others, even in Massachusetts. And we have to be willing to say, in this election next year, yes, we will fight neo-fascism and Trump, but we are fighting in the Democratic Party. We are fighting against the White House military bill. We are fighting against the White House who believes in all of the above energy, including fossil fuels. We are fighting for workers' rights, and we are going to fight to join these things together. And Sandra Jayapal and Ilhan and Frank Kassar, we will work with you, all of us, to build that progressive caucus. But we need real visibility on how we unite these siloed issues day by day, so that the American people, the millions who voted for Bernie and are ready now to vote again, have hope and don't feel that it's hopeless. Thank you.
Thank you very much, Larry, for your passionate presentation. I'm a card-carrying union member myself, so I can appreciate everything that you're saying from that perspective. Jonathan, how much time do we have to the next panel?
You got 4 minutes.
4 minutes. So we have 4 minutes for questions. Jonathan, you might want to take 2 of those 4 minutes to wrap up. And if there are no questions, you can have all 4 minutes to wrap up. William, a question for Larry? And we have Kathleen next.
Actually, I would be interested in anybody's response, but the question is general. Indivisible is an electoral organizing. I have poor internet. That's why I haven't started my video. It goes off if I start my video. Indivisible is an electoral organization, and I support it. But as far as I can tell, their position is any Democrat is better than any Republican. And that has always caused me grief, and I would just be interested in comments on that.
Yeah, I'll give you a quick comment. That's why we started our revolution. I didn't say this, but it came directly out of the Bernie campaign. That's the membership base. And what we say is any old blue just won't do. 85% of House districts are single party districts. So a strategy that's based on electing Democrats means that in the case, and I will single them out, Neil, but I could give you 50 more Democrats. They take the money from the war machine. They take the money from the insurance industry. They take the money from the farm industry and the fossil fuel industry, for that matter. And they're not going to support this kind of agenda that we have. It's a fool's errand. So we have to say we will fight fascism and Republicans whenever we need to, but we will also fight the Democrats that go along with this kind of agenda that we've had. I think the Democratic Party, it's the dominant agenda for my entire life. So we have to fight inside and outside. And when we fight in a so-called popular front to defeat Trump, we have to say then we're doing this, but Biden in your White House, you're never our ally, except for a minute
Thank
here
you.
or there.
Thank you. There's something going on with the audio. I don't know, Larry, whether it's just you or everyone. But thank you for that response. A real quick question from Kathleen and then a minute for Jonathan.
Thank you. I really appreciated Bill's question, and I did hear part of your answer, Larry. But I wonder, since so many of us had trouble hearing you, if you could fix your mic and then just give us a real quick summary, like tell us the main thing you said to help us put together the things, the bits that we heard.
Yeah, so I don't think I can figure out the mic in those seconds.
Just hold real still when you talk. That's all.
Yeah.
Hold real
Okay.
still while you talk.
I'm not used to that, but the mic is probably a different issue. But anyway, the basic thing that I'm saying is that we have to carry the fight in a political way in the 57 Democratic parties in primary elections. And we have to do that with as much energy as we have on policy, not more, on policy, on issue organizing, and certainly the kind of energy we will have to defeat the Trumpers next year. We can't just, as the last speaker said, we can't leave it up to any old blue will do. They won't do. We have to carry that fight on. If we don't do it, it won't happen. And Indivisible, we do work with them, but the example would be, as he said, not me, all too often, it's elect more Democrats and never criticize Biden, even when he supports things like the Mountain Valley Pipeline. That was an outrage. And, we have to be able to do both.
Thank you. Thank you.
Thank you very much.
Thank you, everyone. And thank you very much, Kathleen. And Jonathan, would you like to now take
Sure. We have in Mass Peace Action, we have a political elections committee, and we're part of a statewide coalition with Progressive Democrats of Massachusetts, Progressive Alliance, et cetera. And we agree with what Larry has put forward, that that the only way we're going to be able to influence these sitting Congress people is to challenge them in the primary. And so that means in many cases, you're going to be challenging an incumbent Democrat, right? And so we support that. But however, looking around the kind of political strength you have to have, no single organization can do that, right? We need a situation where we're in the state that the Arrow Revolution Group, the Poor People's Campaign, the Nurses Union, the Peace Action Coalition comes together to find candidates in these primaries. That has not happened in many states in the union. So I myself, the notion that we can actually influence the presidential campaign, we can't even win a primary in a state representative election because of having not formed a broad enough coalition. The time is now, and I agree with Larry and the leader. The fact that there are people in the Progressive Caucus, gives you some hope that there are some allies and resources out there. So Larry, thank you, and thanks to
Jonathan. I would just say all of those leaders got elected in or since the Bernie campaign. So this is not hopeless. All three of them would be an example of that.
Right. All right. So thank you, Carol, and thank you for all the speakers. It's a seamless transition because I'm chairing the second panel, and we're exactly on time. We're going to take a break after this panel, not right now. So stick with us. you're going to hear three national scientists, that biomedical researchers that this audience normally doesn't have access to. So, it was really hard to understand, particularly here in Boston World Center of Biomedical Research, how in this richest and scientifically most advanced nation, the country was totally unprepared to deal with the coronavirus pandemic. We understand that the limitations of the Medicare, Medicaid, private health insurance, hospital system, didn't take care of that. As I noted in my welcome to the whole conference, none of those health insurance programs make any contributions to diagnosing, preventing, understanding the origin of ill health and disease. And they don't finance the development of vaccines, therapies, and new treatments. This is the realm of biomedical research, NIH, National Science Foundation, Center for Disease Control, some of the Department of Energy. And it's divorced, unfortunately, from the direct healthcare workers. So, and totally dependent on the Congressional Discretionary Budget allocations. And as Debbie and Lindsay made clear, those are being, just in a period of time when they ought to be doubling or tripling, no, they're actually being cut. And that means, it's not only teachers are going to be laid off, thousands of graduate students whose labor is necessary to do the work that we need to deal with Alzheimer's, to deal with heart disease, to deal with stroke, to deal with diabetes, are going to lose their positions. Most people don't even know that they're financed by their tax dollars. Just briefly before we go into the actual presentations, Moderna and Johnson & Johnson, they did move incredibly fast to get those vaccines to market. But the reason they were able to move so fast is that most of the key research had already been done by publicly funded research. They already had the structure of the coronavirus spike protein. They already knew what the receptor was, the ACE receptor on infected cells. They already had the sequence, the RNA sequence of the virus. Those were financed by generally NIH. They were deposited in the protein data bank. Every person in the world that has an internet connection can access the structures of the coronavirus proteins, and of course the Moderna scientists. So, a lot of that success depended on this prior investment. It would have been faster if those programs hadn't been cut earlier after the original SARS outbreak. So, we're not threatened by the Chinese. They're not invading us. We're not threatened by the Russians. We are threatened by a new pandemic, and we're not going to be able to defend ourselves against those threats without, much without a real shift of investment. So we're going to start off here. We have three speakers: Eric Sundberg, who's chair of biochemistry at the Emory University School of Medicine, also chair of the Public Affairs Committee of the Biophysical Society, one of the more active such groups. Our second speaker is from New York State, from Rensselaer Polytechnic Institute, different part of the country. And then we're going to move to Catherine Hoyer, and then we're going to move to Ed Egelman, coming to us from the University of Virginia. I can tell you that these people, I've heard them many times. They're all accomplished scientists, former presidents of their societies, but they don't usually talk to an audience that's not their peers. So just give them some slack. They may use some terms that you have no idea what they're talking about. Just raise your hand and say, what's that? And they'll try. So Eric, take it away.
Great. Thank you so much, Jonathan. It's a pleasure to be here and amongst my colleagues who I see on the biophysical.
Wait, one second. The last speaker comes from a different realm, the legal realm. Brooke Baker, an expert on vaccines and patents, and will bring us home to the pressing problems on vaccine access. Sorry, Brooke. Okay, Eric, go ahead.
No problem. We welcome him to round out all the scientists here. So as Jonathan mentioned, I currently the chair of the Public Affairs Committee of the Biophysical Society, and actually everybody, all the scientists on this panel have been or are members of the Public Affairs Committee. And so one of the major things we do for the Biophysical Society on behalf of our members is to advocate on the issues that matter to them, of course, like any other society. And for us, the NIH and the NSF budgets are really one of the most important issues for us to advocate on their behalf, because most of our members' research is supported by either the NIH or the NSF. So the PAC, the Public Affairs Committee, or the PAC, spends more time on and effort on this issue maybe than any other that we work on. And traditionally we and other scientific societies have taken a traditional approach that's to support incremental increases to research budgets. This is the approach of most scientists and most societies that advocate on their behalf. And furthermore, of course, societies, we're a relatively small society of thousands of scientists. So we coalesce together into coalitions to amplify our voices because there are many competing voices, of course, such as lobbyists who are well-financed professionals, and we are mostly volunteers. We generally argue that supporting spending on biomedical research translates to improved health of Americans and also people around the world, actually, and that new treatments and cures for diseases comes directly from biomedical research. Our attitude is generally that more is better, or any more is better. So for instance, I think us and our colleagues were relatively happy with last year's increase in the NIH budget, which was 5.6%. But of course, we have to realize that inflation in 2022 was 6.5%. So we're always, of course, like everybody else, battling real costs versus present dollar costs. So this traditional support for incremental increases to research budgets, I would say, is not really based in any rationale or logic or magnitude of the problems being addressed. So even though we do work hard on this, maybe we're not doing so well. So, and so one could think that, there could be a better way to at least argue for an even larger budget. And so in the recent past, we have been, lucky to have relatively strong increases year over year in the 5 to 7% range. Next year is likely to be more problematic. The White House's proposal for the fiscal year 24 appropriations for NIH is to increase it 2% to $48.5 billion. This is mostly for ARPA-H and for NCI increases and holding everything else steady. We know the House is not the friendliest to non-military spending, and so their proposal is to decrease the budget by 8% to $43.7 billion. And not surprisingly and kind of comically, this is almost all of the cut is directed towards the National Institute of Allergy and Infectious Diseases, which happens to be Tony Fauci's former institute. So obviously this is purely political. The US Senate is a little better, proposes to increase the budget 4% to $49.2 billion. This is mostly to the Mental Health Institute, the National Institute of Mental Health. Us at the BPS and our coalitions are looking for a 7% increase to $50.9 billion. And so that's what we're advocating for. Again, this is a relatively incremental increase that's not based on any specific needs. So if one were to make a more real cost-based ask, what would that be, and how would you go about it? So obviously, the first thing you need to do is define the problem, and then you have to figure out how much would it cost to fix the problem, or how much you would predict it would cost to fix the problem. And then you'd have to figure out how much money is available in the entire budget and how you might shift priorities to do so. So all the speakers in the last session talked a lot about the amount of the large, the overall budget and shifting priorities from military spending to other spending. This would be an example, obviously. So there is a spectrum of matching budget to need, and there are many examples, but some of, we can go through, I'll go through a few examples. And just to set the stage, even though we had the last session and we all know what the military budget was in the almost $900 billion, but just to put that in a little bit more perspective, the cost of all wars after post 9/11 is estimated to be $6.4 trillion. So that's only 7.5 years of the current funding of the military budget. And we have to keep in mind that 9/11 was 22 years ago. So obviously that's kind of overspending, one you could say. So, but then what is our budget for treating disease wars, such as the war on cancer, the war on obesity, the war, all the actual wars that affect Americans? And that's, you could add up the NIH budget, the NSF budget, ARPA-H, these other things. It's about $60 billion. So it's something like 14-fold less than the military budget. So, so if you consider the threats to the citizens of the US to be more disease and health issues than potential wars, like Jonathan said, the Chinese are not actually invading us, then we're grossly underspending. You can do this with a whole bunch of particular things. The cost of COVID-19 was estimated to be $16.2 trillion. So that would be more than 2,500 years of the current funding of the NIH, which obviously is ridiculous. The cost of Alzheimer's, the estimate of cost of Alzheimer's treatments or care in 2022 is $321 billion. Unpaid caregiver costs for Alzheimer's patients or family, really, $271 billion. The Alzheimer's research budget in the NIH is $3.7 billion. So obviously more than 100-fold less than is the actual cost of the disease. Furthermore, by 2050, one can predict that 12.7 million Americans will have Alzheimer's, and that'll cost us $1 trillion a year. And that's probably being conservative. Many other examples abound. Cancer is the same sort of thing. It's cost us $80 billion in 2015. This was well before monoclonal antibodies came on the scene, which are much more expensive. The budget of the NCI is nowhere near this. Heart disease, obesity, also huge numbers in the hundreds of billions of dollars in terms of costs each year. Again, nowhere near what's being spent on them in NIH research. Infectious disease, the list goes on and on. So besides discoveries that are made through NIH-funded biomedical research that could actually treat or alleviate or even cure these diseases, there are other positive impacts of biomedical research on the US economy. There's obvious multipliers that are well known in economics. And the multipliers on biomedical or health spending are quite high. They're estimated to be about 4-fold. Surprisingly, some studies find that the multiplier on military spending is actually found to be negative. Those are global multipliers. Local multipliers can be even bigger. If you're sitting there like in Jonathan's neighborhood in Cambridge, Massachusetts, basically the entire economy of Cambridge, Massachusetts has been a result of funding biomedical research at Harvard and MIT, which has grown into a whole biotech and pharma industry. And one could say that Cambridge, Massachusetts might be completely different. Jonathan might say better, but it would be completely different than if we—
1 minute.
1 minute, okay.
Thanks for the plug.
So Jonathan asked me to talk actually about doubling the NIH budget, and I think that I haven't gotten to that because doubling the budget is actually woefully inadequate, as I've tried to point out, that the costs of the health costs to our society vastly outweigh any amount we're going to spend on them. So the NIH budget, is on the order of $50 billion. Increasing it to $100 billion hardly matters when, the health costs that you might treat with that is in the trillions of dollars. Be that as it may, there are, I guess doubling it would be great because that's much more than we have now, and that would allow us to address at least some of these issues. The NIH budget has been doubled before. You may remember, this audience at least would remember, begun by the Clinton administration and completed by the Bush administration from 1998 to 2003, that the budget actually doubled. And one can look back and ask what happened during that. And what happened was that the number of awards and awardees went up dramatically. After that, it was flattened, things flattened out a little bit, but the number of awardees or principal investigators continue to go up. And since sequestration, actually, things have gone up again. So that's all well and good, but what we can really ask is what was the impact? And there's lots of ways to measure that, but one thing that Jonathan mentioned was our response. One of the responses to COVID was the ability to make vaccines so quickly. And besides the things that Jonathan mentioned, other enabling technologies such as the basics of understanding lipids that encapsulate the vaccines, the mRNA vaccines, and also the way to stabilize mRNA was really launched in this era. And so you can't even measure some of these things, but there's obviously a huge impact by that basic biomedical research funding that supports unpredictable, events like pandemics. So thank you very much.
Thanks, Eric. All right, so a question or comment? Hit raise hand on the reactions. Nothing is popping up in my screen. There'll be time after the presentations to come back. So let's move on to our second presenter, who's going to talk a little bit more about instrumentation equipment, a lot of which comes also from the National Science Foundation. Kathy, are you with us? Hello. Yes. I can't hear you. Unmute.
I'm here and I'm going to try to share my screen just now, if I can.
Green button.
Yeah. It's just, I need 3 screens instead of 2 to do this right. But anyway,
Yes, we see it.
Okay. All right. So I'm here to explain a little bit about what kinds of things you see we obtain when we get funding from non-discretionary funding sources in the congressional budget, and why it's so important. And I want to stress that over the years, the past few decades, biology has become a really quantitative field. And the reason for that is that we need to understand and modulate biological function in order to cure disease. And knowledge of the shapes of the dynamics of the biomolecules and why they've misfunction in disease is necessary to be able to try to mitigate them. And so the consequence of needing this very, very detailed information is that biology has become really expensive over the years. You may think of a biologist sitting at a bench with a petri dish, and it's no longer at that level of biology. I show here on the left side of the screen a beautiful image of the structure of a ribosome. here. This is a ribosome, and this is the messenger RNA, like the one that's in the vaccines that we all took against COVID. And this ribosome is a little machine, tiny little nanometric machine that's actually making protein here with the help of what's called transfer RNA here. And that would be the antibodies that the vaccine elicits when you get injected with the mRNA. And so we have a very intimate understanding of how this all works, and that's based on years and years of funding of biomedical research. So, like I said, we use these biomolecular structures to design drugs to treat human diseases, and Jonathan spoke about the SARS-CoV-2 virus, and there are many just possible examples one could take. We all seem to have chosen this one, but there are many more. So there's this spike protein. Here's a structure of the virus with this spike protein that the antibodies that the vaccine elicits bind to. And so, to be able to get antibodies to neutralize this virus and block infection, it's really important for us to have the structures of the proteins involved. And moreover, proteins are not just entities that are frozen in space and time. Proteins, these tiny little nanometric machines, they move all the time. They move a lot. And so we need ways to understand how they move. They don't just have one structure, they have many. And so we need machines to understand that as well. So here you have the two what we call conformations of this spike protein that sticks out from the virus. And then these are pictures of antibodies that would bind to it, and we have to know exactly like why they're binding to certain parts and how they fit. Also, SARS-CoV-2 and also HIV and HCV viruses, which are deadly, all of them, have proteases, and some of the drugs to treat these diseases are targeted at the proteases, and this also in Paxlovid, for example, is targets the protease in SARS-CoV-2, and here, to be able to do this targeting, we have to have really detailed information at the scale of 10 to the minus 10 meters, right, which is very small, right? And so we need structures of these things in order to design and test these drugs. And so how do we do that? So I'm going to tell you a little bit about how that gets done. I'm going to talk about X-ray crystallography, NMR, and also computational approaches. And Ed will tell you about this really exciting technique called electron microscopy. So I won't say anything about that, but it's the best things in sliced bread, I would say. But the workhorse for getting structures of biomolecules has been X-ray crystallography over the years. And X-ray crystallography requires a thing called a synchrotron light source. And these things are huge buildings with a big round tunnel inside into which you inject electrons and they fly around super fast and emit radiation. And we use the X-ray radiation that's emitted by these things to blast crystals of proteins, for example, or ribosomes or anything else. And then we analyze the patterns of where those X-rays go after they've hit our crystals to deduce the structures of biomolecules. And so at all synchrotrons all around the world, there are one of these or several of these, what we call beamlines, are used for X-ray crystallography. And these things are super expensive. They cost $500 million to build. And lately they're getting more and more expensive because they're getting better and better and brighter and brighter. And so we can do more stuff with them, but they're really expensive to build. There's expensive to operate, maybe not on the level of the military budget, but for us poor scientists, it seems like a lot of money. And each beamline, it costs about $3 million to construct, and about as much to maintain every year. So I'm going to tell you a little bit about what's going on at a synchrotron called the Center for High Energy X-ray Science at CHESS, or CHESS at CHESS. CHESS synchrotron is in Cornell, just down the road from me, a little bit farther from you all, and a lot of really beautiful biological structures and structural information come out of CHESS. But the CHESS has a problem. Most synchrotrons in the United States are funded entirely by the Department of Energy. The Center at CHESS was originally funded by particle physics at National Science Foundation, but then they shifted it over to materials research at the NSF, and then they said they didn't have enough money to pay for it, and they moved CHESS into what they call a partnership agreement, which just means that the people at CHESS had to find others who would be happy to fund what the research that was going on there. And so now NSF only funds 4 beamlines, and the NIH funds 1, but not completely, because since the NIH budget hasn't been keeping up with inflation, they can only partially fund the beamline. And so all in all, CHESS has had to come up with other ways of funding the operations and upgrades, because you always need upgrades at the synchrotron. And so ironically, the Air Force came to the rescue because they have money, right? And so the Air Force now funds 2 beamlines and may fund more, which is, I guess, good, because that means CHESS will probably not fold anytime in the future. But what that does mean for us, biomedical researchers, is that we're going to have a lot less beam time to deal with, to do the sorts of things that I just showed you. That's the problems at CHESS. As I said, proteins move, and so we use techniques to try and figure out how they're moving and what other structures are there. And so for that, we often use a technique called nuclear magnetic resonance, and it needs these huge super cooled magnets. You can see it here. You know, a person is about this tall, and so here's this huge magnet. The largest now on the market are 1.2 gigahertz fields. And just to give you some idea of what this means, so usually a magnetic field is given in Tesla, which is 10,000 Gauss, and that's about 50,000 times the magnetic field of the Earth. And a 1.2 gigahertz machine with this super cooled superconducting magnet has a field of 28 Tesla, give or take, and that's 1.4 millionfold the Earth's magnetic field. And so you can imagine, to build these things, it costs a lot of money, at least a lot of money in our frame of reference. So they're about $18 million. Even a workhorse NMR that every university and research center in this field needs is a $2 million investment. So again, biology is just costing more and more, and giving more and more back to people. So, and finally, computational biology is really important. And of course, if you do things in a computer, it's going to be somewhat cheaper than actually doing the experiment. A lot of times you need at least a little bit of both, but it's not as cheap as you might think. You have to purchase the clusters, you have to purchase, the capacity. And then, it needs a lot of electricity, to run and to cool these things. And so even computational science isn't as cheap as you might think. But the last real cost for for providing those pictures of ribosomes and mRNA and the spike protein and all the things that we need to be able to come up with ways to treat people for dread diseases is people. People cost a lot of money, actually, and not only do they work, but we have to train them. And training people in these more and more complicated fields is becoming more and more expensive all the time. And so overall, I would say, we really could use a doubling of the NIH budget, even though, as Eric says, it's a small drop in the bucket compared to what we would really need to seriously, even more so, address these health challenges to U.S. citizens and to the world. So keep in mind, that the money isn't just going anywhere. It's going to creating really good and exciting science that is really useful for people. So thanks very much.
Okay, thank you so much, Kathy. Questions for Kathy on NMR or X-ray crystallography or chess for the people? Okay, I guess it was a model of clarity. Having those numbers, actually having very, very, very useful. People don't know it. By the way, Massachusetts gets about $3 billion from NIH a year, pays this salary of thousands of graduate students, research technicians, completely invisible. Doesn't come through the state legislature. It comes directly to institutions and PI. So, people don't know that. I still find that my neighbors think that graduate students at MIT pay MIT. They don't understand that. No, they get paid by tax dollars. All right. Next up, we're talking about cryo-electron microscopy. Wonderful technique. Ed Egelman from the University of Virginia. Ed. There we go.
Okay, just a minute.
Yep, we see your slides.
Great. Okay, thanks very much. And thanks also for the wonderful introductions given by Eric and Kathy, who basically set the stage for my talk. I'm going to talk about this amazing technology that's really emerged only over the past 10 years, even though aspects of it have been around for 50 years. There's been a revolution basically in structural biology, and I would say in all of biology, allowing us to now nearly routinely determine atomic structures of biological complexes, such as viruses. Shown on the left is a gallery of viruses whose structures we've determined that infect hosts living in almost boiling acid. So this is 90 degrees Celsius at pH 2, which is, so it's not an exaggeration to call that boiling acid. And while this is very, very basic science that we're interested in, understanding these things can give rise to a whole new generation of biotechnology. For instance, how you can prepare proteins and nucleic acid to survive such extreme environments, which could be the basis of many different biotechnology applications. So the electron microscope has been around for almost 90 years. This on the left is the first electron microscope that was built in Germany by Ruska in 1936, and it was originally used for physics and material science studies. About 10 years later, in the 1940s, the first applications were made to biology. And on the right, I'm in there just to show you the scale. I rarely get to stand near the microscope or put anything in it. Is a robotic modern cryo-electron microscope. This is an amazing device because on the old microscopes, you might be able to take 40 pictures a day. Actually, I'm sure in that earlier one, it was even fewer, but with the best microscopes, we were taking 40 or 50 pictures a day. This new one is completely automated and allows us to take about 6,000 or 7,000 movies a day. These are not images, these are movies, because the cameras in here are so fast at 400 frames per second that you can actually record the image as the electrons are illuminating your sample, and you can then correct for the movements that are induced by this beam. And this allows us now to get this very, very high resolution almost routinely. So Dobzhansky is a famous geneticist, and he made an often quoted statement that nothing in biology makes sense except in the light of evolution. You can't understand anything, whether it's a virus or a horse, without understanding how it evolved. And in the time of Darwin, the only tools available for understanding evolutionary relationships were really bones, fossils, and the very crude morphology of organs. There was no knowledge of proteins, no knowledge of DNA. And based upon this, I mean, Darwin drew extraordinary conclusions. There's only one or two examples where he was wrong, and that was on the eye. He looked at an insect eye, which is multifaceted, and he looked at a vertebrate eye, and he said these are so different that they must be an example of convergent evolution. That is, they arose independently, and then they both converged to the same function of being able to see light and images. Well, with molecular biology, we now understand that Darwin was wrong. They both had common ancestry, and that's based upon looking at the proteins that are present in both the insect eye and the vertebrate eye. So over the past 50 years, people have moved from studying bones and fossils to studying DNA and proteins. And this is a slide from the National Library of Medicine, which is part of the NIH, showing the exponential growth in genomic sequences starting from around 1990, when the first sequences were being collected. And for many years, this has defined our understanding of how humans evolved from apes, and apes evolved from lower primates, and ultimately how we all evolved from bacteria based upon looking at these sequences. I would like to argue that now we have new tools that give us much deeper insights into biology, which is based on structure. Now, as Kathy said, the main tool for most of the past 50 years for determining protein structure, and the first ones were determined in the mid-1950s, was X-ray crystallography, which is very slow, laborious, and requires a lot of material. But this is a plot of the number of atomic structures of proteins deposited in this international repository that the US started, Protein Data Bank, showing the ratio of the number of structures determined by X-ray crystallography versus cryo-EM, and it's on a log scale. So if you go back 20 years ago, the ratio is about 300 to 1. For every 300 structures determined by X-ray crystallography, one was determined by electron microscopy. And then about 10 years ago, in 2013, new technology was introduced. I won't get into that, but it has to do with what's called direct electron detectors. And that technology actually came from X-ray astronomy. So this is another example of how very basic science can lead to unanticipated benefits in many other fields that are quite far removed from the initial applications. And that means that now, in last year, 2022, there were 2.5 X-ray structures for every one cryo-EM structure, but this trend looks like it's continuing, so that this year we expect there'll be parity. There'll be 1-to-1 X-ray structure, cryo-EM structure, and in all successive years in the conceivable future, cryo-EM is going to dominate all of our ability to determine structures. So crystals are no longer needed, and that's nice because we now need very small sample quantities. For instance, we found 82 virus particles as a contaminant in one recent sample that we looked at, and that was sufficient to determine an atomic structure of that virus. Okay, this was inconceivable 10 years ago, and it was beyond inconceivable 50 years ago when people were generating the first protein structures. It's also because of this automation, the time from having a sample to having an atomic structure can be days. In the best of cases, it can be weeks, months when problems arise. But let me just talk about viruses. There was a very important paper that was published by Watson and Crick in the 1950s, and it's not the structure of DNA. This was an entirely speculative paper noting that all viruses that have been observed and this was observed at very low resolution, are either spherical or rod-like, and they conjecture that this has to do with symmetry, that you can form a rod-like virus from a single protein that's arranged in a helical polymer, and you can form a spherical particle, actually an icosahedron, from only 60 copies of a protein arranged into a shell. And that's why these viruses are all either spherical or rod-like. An example of a icosahedral virus is SARS-CoV-2, and as several people have pointed out, the ability to generate a vaccine so rapidly hinged in large part on all the structural biology that had been done on related SARS viruses, going back to the original SARS pandemic. And this sort of montage represents different levels of cryo-EM structure determination of all the components of the virus. So this basic technology, which no one anticipated, would be applied to a pandemic, really understand the pathogens that are causing these diseases. So here's an example of viruses, again, living in some of the most extreme environments on Earth, nearly boiling acid, that don't conform to that paradigm. Instead of being spherical or rod-like, they're lemon-shaped or spindle-shaped. And this was completely not understandable based upon all of our knowledge of biological structure, how you could form something simple like this from, let's say, a single protein that would have such a shape. And what we showed last year is that the single protein shown on the right, and that's an atomic structure of this protein determined by cryo-EM from these virus particles, not from a crystal. And we can explain how this thing packs together into this distinctive shape. Again, this is now becoming almost routine. So Rosalind Franklin did pioneering work on the structure of DNA, and her X-ray diffraction observations led to the Watson and Crick model. But she observed in the laboratory that you could find two different structural forms of DNA. The first one she called an A form, the second was a B form. If there was a third one that she found, it would have been cDNA, but there was a leap over many, many years until someone at MIT proposed a structure for zDNA. So it went from A to B to Z, skipping a lot of letters in between. But the conditions that she used to get the A form DNA were desiccation, drying the DNA in the laboratory. And then if you added water again, you could get it to revert back to the structure on the right, the B form. So the dogma that emerged in biology was this: that A form DNA was a laboratory artifact. You would never see it in biology because there's no biological specimen that's desiccated, completely dried. It turns out that dogma is wrong. And what we showed is that another family of viruses that live in these extreme environments, all the DNA is packed in this A form. And this is a three-dimensional reconstruction of the DNA structure determined by cryo-electron microscopy from a relatively limited number of virus particles. And we've been able to extend this now and show that there are bacterial spores and lots of other entities that live in the most inhospitable environments that maintain DNA in this A form, which is as biological really as B form. It's just been underappreciated. So how much time do I have?
You're out.
I'm out. Okay, so then I'll skip the last, which is the most interesting part, and just acknowledge people in my lab who've done all this work. And we've had terrific collaborations with people at the Institut Pasteur in Paris. Science is a very international enterprise. And most importantly, we've had extended support from the National Institute of General Medical Sciences to do this very, very basic biology. Thanks.
Thank you. Thank you very much, Ed. And, no, it's really a leap. We need many, many, many more cryo-electron microscopes around the country.
So can I just add that the cost of that instrument is pretty small compared to some of the things that Kathy showed. It's about $5 or $6 million. The operating expenses, though, are a little pricey. So once you get that microscope, it costs us $1,000 a day to maintain it.
I can't resist adding a personal note. I mean, the reason I live in Cambridge, Massachusetts is because in the late 1960s, MIT decided that if it was going to enter into the world of biology, it needed to have advanced instrumentation like electron microscopes. And I was hired because I was at that time no longer an expert on electron microscopy, and wrote the grants, the NIH grants that brought the first. I had one of those I inherited one of those historic microscopes, but in those days it seemed like a fortune, $100,000 for new electron microscopes, and of course, peanut. Nowadays it's millions to stay au courant. I want to let's go on to Brooke Baker, and then we'll come back to questions of the whole group. So Brooke is on the faculty of Northeastern Law School and an authority on patent issues, in particular how they impact on things like vaccines and vaccine availability. So, Brooke.
Well, it's a great pleasure to come after scientists who tell us, what money can be used for. And although the title of what I'm supposed to talk about is the CDC and vaccine access, I'm not going to limit myself to that. I'm going to discuss global interests and access as well as domestic, and really put in a pitch that we need to think about global needs as well as domestic needs. I think it's far too often in the US, even among progressive folks, that we focus narrowly on domestic needs to exclusion of global needs and global solidarity. And that expanded focus is particularly important in the health context, but of course the climate context as well. Our health domestically, our climate domestically ultimately depends on the health and climate of others. And no solution that would really keep us healthy and in a healthy climate can be accomplished if we don't pay attention to our brothers and sisters elsewhere in the world. So, part of that is to also, in terms of the science that's been discussed previously, is to focus on some unmet needs that are global. And of course, I could spend a lot of time talking about neglected tropical diseases, and of which there are many, and for which there's very little research. And the reason there's very little research, there's some basic science research, of course, and there's some applied research as well. But the major reason there's not significant advances in these areas and not significant portions of NIH and other budgets is because these are not diseases that affect richer people in rich countries. And because they don't have commercial market prospects for the biopharmaceutical industry. And so, partly what happens in terms of the priorities of research undertaken is that those priorities are increasingly directed by corporate interest. To talk about corporate interest is nothing new for this group. You talk about corporate interests all the time with respect to military budgets. And I know you do with respect to when you talk about climate as well. But it's certainly true in the biomedical field as well, that increasingly, even at the university level, the research priorities are directed significantly, even when there's federal funding, public funding, by the possibility of commercial prospects and the likelihood of meeting largely domestic health needs. And that leaves that vulnerable. For example, neglected tropical diseases are moving north because of climate change. In our southern states, we are now having exposures to diseases that were typically thought to be tropical diseases, but they are encroaching into the southern border as we speak. And there's so little spent. It's almost embarrassing to talk about the figures that we on the truly neglected diseases, the ones identified by WHO. taking out HIV, TB, and malaria, which all remain underfunded, but are significantly better funded than the other neglected tropical diseases. It's a little bit over $300 million a year that's devoted solely to R&D in that area. And there are, historically, the estimates vary, but between 1 and 2 billion people globally who live with neglected tropical disease. Many of whom die, though death is not the major outcome of those diseases. It's much more morbidity. It's being sick, being disabled as a result of the illness of neglected tropical disease. The U.S. is a major funder, but even though it's a major funder of the broader class of neglected diseases and even of neglected tropical diseases, it's still really a drop in the bucket in terms of the scale of research that's needed to meet these needs that are coming to us domestically, but largely exist internationally in other areas of the world. We've heard already quite a bit of talk about COVID-19 and the possibility of future pandemics, and the estimate of the unmet need to address the risk of pandemics, the growing risk of pandemics, and to do the basic research that's needed is approximately $50 billion a year. Now, some of that goes into health system strengthening and prevention and a bunch of other things, but a lot of it goes into basic science research and then applied research to try to bring the promising vaccine platforms and therapeutic platforms and even advanced candidates so that they could be brought to the market very quickly. We were so lucky with the COVID-19 pandemic that we were able to come up with a vaccine as quickly as we did. And as previously mentioned, that's largely on the back of publicly funded research in vaccines, and including messenger RNA vaccines in the preceding 2 decades. That publicly financed research was what the industry grabbed to finalize and take some of the final steps. But even some of those final steps, NIH certainly has patent claims to some of the spike protein of COVID-19. But we spent significant money. I mean, we really doubled. We 20 times the investment on coronavirus in response to the pandemic than we had ever spent previously. And that was an example of government responding with alacrity to the risk that was before us. They could have and should have spent more, but the Operation Warp Speed really put a lot of money on the table that helped finalize the development of promising vaccines, diagnostic tests, and therapeutics. But then what did we do with that? And one of the things I want to talk about is we're not getting the bang for the buck that we should from the existing publicly funded biomedical research, let alone would we from doubling or tripling or quadrupling that research if we don't stop the privatization of the fruits of scientific research. At present, NIH funds these fine scientists we've heard from, our major universities, research universities. And then when they come up with something that, passes the smell test for being patentable, university technology offices insist that they be patented. And then often there's either a spin-off company, a startup company, or direct licensing to a major biopharmaceutical company. And they take that research, the fruits of scientific endeavor, all that work of graduate students, all the work of these fine mentors who we've seen as in previous 3 speakers, and they privatize it. And they take intellectual property monopolies in several forms. They take intellectual property monopolies in the form of patents. They take them in terms of trade secrets. They take it sometimes in terms of copyright and industrial designs. And they use these intellectual property monopolies to exclude competitors. And I want to use the COVID-19 example in particular. So we were lucky that we came up with these new technologies. And in a rational world, what would have happened, and what the US government would have insisted as an addition of the funding that it gave to these researchers, is that we would make sure that there were adequate supplies, affordable prices, and equitable distribution to everyone in the world, which would have reduced the pandemic risk of all of us, and certainly have reduced the risk of mutation and the new variants that we experienced over the past 3.5 years. But instead of that, NIH funding comes with no strings attached. There's no requirement of IP licensing. There's no requirement of technology transfer. There's no requirement of helping to build research capacity and clinical trial capacity. There's no real effort to have clinical trials that really are high-powered, that compare different products, that really help us decide what is the best products to actually give to people domestically and abroad. And what do we get from that? What's the end result? We had inadequate supplies, artificially restricted supplies, because the drug companies, vaccine manufacturers would not do technology transfer with companies they weren't in tight control of. They engaged in contract manufacturing contracting, but they did not really give their technologies to other countries, companies in other countries to expand supply. They set high prices and made huge amounts of profits. The profits made by the biopharmaceutical industry and the COVID, even through the middle of last year, was over $100 billion. That's just the profit. That's the pure profit. It was high prices, needlessly high prices. Many of the vaccines, which cost $1 or a couple dollars to manufacture, maybe a little bit more, were sold for much more than that. And that resulted in the new billionaires that we now have in Cambridge who worked at Moderna, who are really new billionaires off of the scientific effort of so many, including many of the dollars from public financing. And as problematic that is in a rich country where the research money that we're fighting for to fund the research that people have talked about, that what we're fighting for is so important. But we got it. I mean, there were vaccine deserts in the US. Not everyone in the US, especially Black and brown people, got the vaccines at the same rate as richer communities and whiter communities got. But when you compare our access and the speed of access in the US to people in the developing world, people in low and middle income countries, it was abysmal. And low income countries still have not come close to vaccinating the majority of their populations, even 3.5 years into the pandemic. So, in addition to thinking about this idea of getting more money for research, which is critically important, we really have also simultaneously need to talk to our scientists and talk to our politicians that when the public invests, there ought to be public returns domestically for sure, but public returns globally as well, especially in the context of pandemics, but health more broadly, especially in the context of climate as well, where the benefits of new technologies in the climate field similarly would need to be shared globally instead of monopolized and sold at high prices preferentially to rich countries. So, I hope to, try to add just a little bit to the discussion about the need for global access and the need for conditions to reduce the misuse of corporate power that artificially restricts supplies, raises prices, and results in inequitable distribution. Thank you.
All right, thank you. Thank you so much. All right, let's open the floor for a last question or comment. All right, well, that's what happens when you have real clarity. Brooke, do you have a website, a URL that you could put in the chat that people could go to find, more of your writing on this? So Elaine has her hand up. Elaine, you're muted.
I just have a question for one of the speakers, for Edward Egelman. I mean, all these were fascinating, and it would take a while to understand the implications of everything that's been said. But Yeah, I just had a quick question because a layperson usually understands what you're identifying as Rosalind Franklin's B crystal image, X-ray image, as the image that led Watson to infer the double helix structure with his Tinker Toys. But I was confused if model A is then completely different than the B and not just a kind of laboratory artifact. Does that mean, where is that in relation to the double helix? Is that an alternative form, or was that something other than DNA?
No, it's an alternative form. You can actually get the A form to go into the B form by adding water. So it's chemically identical. It just exists in a different conformation. But that different conformation was assumed to be non-biological for many, many years until we and others have shown, no, actually, this is exploited as a protective form of DNA in the most aggressive environments on Earth.
Thank you.
All right, thank you. Okay, so we're out of time. We're going to take a 5-minute break and come back in 5 minutes. Do come back in 5 minutes to hear Elaine talking about nuclear war dangers and the speakers of nuclear weapons. So 5-minute break, and then we'll be back. Yeah. Everybody showed up. Everybody was prepared.
Are you on mute?
Bob,
Yes.
you're okay. 5 minutes. I think we're at 5 minutes. Take it away.
Okay, well, thank you very much. For those who don't know me, I'm Bob Redwine. I'm a professor of physics at MIT, and my research specialty is experimental nuclear physics. And while I've not personally worked ever on nuclear weapons, especially early in my career, I got to know a number of people who had worked on the Manhattan Project and were then trying very hard to get rid of all nuclear weapons. And the reason they had worked on the Manhattan Project was largely because they were so afraid that Hitler would get nuclear weapons before the Allies did. But then when that, of course, did not happen, they were extremely disappointed at the bombs being used on Japan. And they worked hard the rest of their careers and had a big influence on me concerning the hope that we can get rid of all nuclear weapons. The topic for this panel is the costs and dangers of nuclear weapons modernization. And as I'm sure all of you know, this modernization has in fact received pretty strong bipartisan support in Washington in recent years, which is very worrisome. And we really need to change directions on this issue, both because the funds that are being used for it could certainly be used better to address other issues, but also because it just increases in the future the dangers of nuclear weapons. So I plan to introduce each one of the four speakers just before they give their presentations. And the first speaker is, of course, Elaine Scarry. She is the Cabot Professor of Aesthetics and General Theory of Value at Harvard University. She was previously Professor of English at the University of Pennsylvania. Elaine has had a long interest in nuclear weapons issues, especially concerning the dangers of power to use such weapons being in the hands of such very few people. She is going to talk to us today about the dangers of first use. So, Elaine, I'll turn it over to you.
Thank you. It's one way to get rid of nuclear weapons and to transfer money over to the kind of true health care issues that we've heard about throughout today is to support the International Treaty on the Prohibition of Nuclear Weapons. And a second way is to support our own national law, our own constitution, which will enable us to dismantle presidential first use of nuclear weapons. And by doing so, we'll introduce a spiral fracture into the whole nuclear arsenal and help us to eliminate it. Either the international law or national law will let us do that. I'm going to elaborate that in a minute, but I'm first going to try to share my screen to just make sure to make visible the relation of this subject to the healthcare issues we've been hearing about. I'm having a little bit of trouble.
Your screen, the green button.
The green, which green button is that?
At the bottom of the, you might have to move your cursor down to have it light up.
The only green I see is share screen.
Yeah, that's what you have to do.
One.
Oh, I had already done that. Yeah, okay. Sorry, I get it now.
And you have to pick what screen you want to share.
I can share your screens, Elaine, if you wish.
Okay.
I mean, sorry, I can share your slides is what I'm trying to say.
Well, while Cole is working on that, let me just start in on first use. And here's a picture of our nuclear architecture. Nuclear architecture really has two key features. The first feature is its staggering ability to bring about a huge amount of injury. And as you may know, the most current research on nuclear winter shows that if a tiny fraction of the current worldwide arsenal, which is now up on the screen, if a tiny fraction of that is used, namely 0.04% of what you're seeing there, 20 million will be killed on the first afternoon, and 2 billion in the first month. But it's and the International Red Cross has said that that even if one city is hit, it doesn't have the resources that can possibly begin to address those injuries. In this image, everything from 3 o'clock around to 7 o'clock is owned by the United States. Everything from 7 o'clock to 1 o'clock is owned by Russia. So together we own 90% of the warheads. And this little wedge up by 1 o'clock or 2 o'clock are the other 7 nuclear states. The blue are submarine launched weapons. The orange are the ICBMs. And the green are the air-delivered systems. And at the center of this image is the doomsday clock, which is currently set at 90 seconds to midnight. So the destruction is really vast. If you go to the next slide, it shows a bridge. And this is just, for a moment, I want to contrast that staggering level of injury with that's going to be brought about by a largely invisible nuclear architecture, has to be contrasted with the architecture we do see, the infrastructure we do see that is in a deplorable state and is an alternative form of bad healthcare. You may remember the Pittsburgh Bridge that collapsed in 2022. Next slide, please, Cole. This was the report by the Pennsylvania Auditor General that showed all the bridges in Pennsylvania that were in a structurally deficient condition. Then next slide, please, Cole. Then the American Society of Civil Engineers, in its 2021 report card on infrastructure, pointed out that 46,000 of the nation's bridges, 46,000 are structurally deficient. They are in poor condition. Those are bridges over which each day 178 million trips are made. Now, the American Society of Civil Engineers gave our bridges the grade of, as you'll see in the next slide, Cole, gave our bridges a C, not a very bad grade, considered that that many thousands of bridges are deficient. So you can appreciate how very bad our roads must be. Next slide, please, Cole. When you realize that they gave our roadways in the United States a D, and again, they accompany this with very specific information at how they arrived at that grade. And next slide, please, Cole. Our transit a D minus, and next slide, please. Our schools a D plus, and that's not our teaching, but the physical plant of our schools. And next slide, please. Our parks a D plus, and next slide. And our levees, just to move outside Massachusetts, 30,000 miles of levees, which are currently in the state of D, even though 17 million people are behind those. So you could now close this screen share, please, Cole. So this gigantic level of injury has as its counterpart the infrastructure that's not being supported by American dollars. And all this, the tremendous injury that's brought about by nuclear weapons is accompanied by a second feature, and that is that these weapons are fired by a single person. In the era of Trump, everyone was a bit worried about this since he seemed reckless. People worry about President Putin because he seems reckless. They worry about the leader of China. They worry about the leader of North Korea. But it doesn't take an unusual or unstable leader to be a problem, because we have a historical record documenting who has considered using presidential first use, and that includes people that are nominally thought of as sturdy. President Eisenhower, President Kennedy, President Nixon, President Johnson, and each of them has considered using presidential first use between 2 and 4 times. So these two crucial features are things that are each addressed in different ways. We have, as I said at the opening of this, 2 different tools for dismantling the nuclear arsenal. One is the International Treaty on the Prohibition of Nuclear Weapons, which has been signed by 98 countries and ratified by 68 countries. And it is based on the illegality of bringing about that kind of injury, that massive injury. Our constitutional law, which specifies the very elaborate and widespread people that must be involved in any decision to carry out an act of war against a foreign population, that constitution is addressed against the second feature of nuclear weapons, the fact that they are all there to be fired by a single person in presidential first use. So the two
1 minute, Elaine.
Okay, so the 2 features are magnification at one end, miniaturization at the other end. We have international law addressing one, constitutional law addressing the other, and either one of these alone is capable of eliminating the nuclear arsenal altogether. But I think that we have a much greater chance of doing it if we put all that we have into supporting both of these and into the international treaty, as well as the efforts both in the Congress and in law courts to address presidential first use and replace it with a no first use policy. Thank you.
Thank you very much, Elaine, for that important presentation. Are there any questions right now? Don't see any. As you know, we will have time at the end of the 4 presentations for talks, for questions. So let's move on then to Richard Krishnick. Again, thank you, Elaine. Richard is a key member of the Massachusetts Peace Action. He's written a number of articles on how the military-industrial complex influences Congress and the public, and on the dangers inherent in a new generation of nuclear weapons. He's active in the MAPA disarmament work and active in Latin American and Caribbean working groups. He's also active in community development in Nicaragua and in creation of a Massachusetts public bank. So I'll turn it over to Richard, who will address the destabilization driven by nuclear upgrades. Thank you. I think you need to unmute yourself, Richard.
A lot of important people who know a lot about the dangers of nuclear war. I think most of us are familiar with ex-Secretary of Defense William Perry, Sam Nunn, long head of the Senate Armed Services Committee, Henry Kissinger, a number of others are telling us that we're in far more danger of nuclear war at this point in history than we were certainly since the 1962 Cuban Missile Crisis. And as the Ukraine war drags on, so far, I think it's safe to say that day by day, the danger of nuclear war emerging from the Ukraine conflict is increasing. Russia, indeed, whether rightly or wrongly, Russia perceives this conflict as an existential threat. They will definitely use nuclear weapons if they are seriously losing the conflict. They think the existence of Russia depends on not losing this conflict badly. The United States has a different viewpoint. It's trying to prolong the period of sort of US unipolar dominance as it is slipping away, try to grab another couple of decades before it's gone in the economic unification of the Eurasian continent. Are the US leaders so desperate to extend this semi-hegemony that they might use nuclear weapons if the Ukraine and US side are seriously losing the war in Ukraine. That's also a possibility. At any rate, one thing is certain that makes the danger of nuclear war at this point in our history much more likely, and that is the specific characteristics of the new generation of nuclear weapons. The previous generation of nuclear weapons were inaccurate. You know, the intermediate range and intercontinental ones had you know, half of them were supposed to be able to hit a target within 300 yards or something like that. The battlefield nuclear weapons in previous generations were much more accurate, but on the battlefield, the small nuclear warheads would destroy that much. So their level of inaccuracy was still pretty terrible, even though it was much smaller than the long-range missiles. But the new generation of nuclear weapons is pinpoint accuracy. We're not talking about half of them hitting within 300 yards of a target. We're talking about all of them hitting within 3 to 10 yards of a target. You know, it's an entirely different ballgame than it was before. Before, you had to have big warheads to be able to think you could take something out because they were so inaccurate. Now you can have a little warhead with a very high probability of taking out any kind of a target that you want with far less collateral damage, as long as it's a very limited battlefield use. So it makes it very tempting to use them. The United States has the new W-76-2. It's about, the warhead is about the size of a Hiroshima bomb. They are now they're now on our submarines. They've replaced a lot of the W-76-1s, which had a blast about 6 times the size of the Hiroshima bomb. Well, they're out there floating around and ready to be used. The B-6112, that's, by the way, is a dialable warhead, the one that's on the submarines. You can dial the blast in some very limited range that I don't know. We also have the B-6112. It's also on our Trident submarines. It's stored and deployed in 4 countries in Europe. It's all over the place on land and sea, and ready to take off in airplanes with forward missiles on bases in Europe and so on. The B-6112 has a dialable warhead from 1/43rd the size of a Hiroshima bomb to 3.5 times the size of the Hiroshima bomb. These weapons are designed, the previous generation was designed to deter either side from doing anything, because they had these giant warheads and everybody'd get wiped out. Well, we still have that with the new generation of intercontinental ballistic missiles and intermediate range ballistic missiles. But there never were real battlefield nuclear missiles. There never were versatile, dialable, super pinpoint accuracy warheads and delivery systems that you could actually use on a moving battlefield to take out specific targets. But now both sides have them. Fortunately, we haven't given them to Ukraine, but Russia has them, the US has them, NATO has them. They go all the way from artillery shells that have a blast about 1/20th the size of a Hiroshima bomb and a range of about 10 miles, you know, to all the way on up, and all kinds of different delivery vehicles. If Russia decides to use one of these because they're losing badly, or if the US does, it's bound to be a little test drive. One small warhead battlefield weapon, or maybe 2, takes out a big military base, or takes out some very significant complex of infrastructure or something like that. Well, what's the other side going to do? There's no defense against these. neither side can shoot down any of these delivery vehicles that can deliver this battlefield warhead. There's no way of stopping them if either side wants to use them. So what's the other side going to do? They just going to let Russia, or Russia's just going to let the US use one little battlefield nuclear warhead? I don't think so. I think there'd be a response. Well, that's where it goes on from there. And it's all the war games I'm aware of, it always ends badly and very, very quickly, and takes us into the territory of nuclear winter for some number of years, where some significant portion of global agricultural production is cut off and some meaningful percentage of all life on Earth is no more. It only takes about 100 Hiroshima-sized warheads on urban targets. So I know you don't hear it very often. In fact, I've never heard anybody else say it, but I think at this point in our history, the largest environmental problem in the world is not global warming, it's nuclear war. Just one of these tiny warheads, the one that's only, it's like
1 minute, Richard.
It's like 1/3 the size of the Hiroshima bomb, dropped on downtown Boston, and, takes out all of downtown Boston, kills instantly 46,000 people and wounds 95,000 more, that kind of thing. So that's, I guess that's about it. All right, I'm done.
Thank you very much, Richard. It's certainly a frightening prospects. Are there questions right now for Richard? Won't everybody hold back? Probably, well, we will have, of course, time at the end for questions for all of the panelists. Yeah, there's a question from Regina.
Hi, this is Regina from San Francisco. On September 5th, there was a ICBM missile test launch at Vandenberg. And this time, instead of having one mock warhead, they had 3. That would violate the START treaty, if the START was active right now. I just wondered if people were monitoring that, were remembering that we have these tests 4 times a year. The news release that they sent out this time specifically mentioned Russia and, said we were not firing, this is a test, but we're getting prepared for war. So I just wanted to remind people of that and encourage people. There was a small protest of 4 people there. And we need, if you have friends that live near there in Santa Barbara or that county, make sure that they're aware of these launches and maybe they can get involved. There needs to be more demonstrations. There's a wonderful, if you go to Wikipedia and look up the word ICBM, which I did to find out the history of ICBMs, there's actually a launch video there in the first paragraph from the April test. So if you've forgotten what they look like, which I kind of had forgotten, I was, there's the ground opening up and the missile going off. So I just wanted to mention that and encourage us all to remember about we don't need to spend $23 billion to initiate building a new Sentinel missile to replace missiles, to upgrade missiles. Waste of money. So let's do something about that too. Thanks for listening.
Thank you.
May I comment on that?
Please do.
I believe she was introducing missile defense as well as missile offense there. And I just wanted to note that Raytheon's preeminent SM-3 is the only contender at the moment for a missile defense against intermediate range and intercontinental missiles that supposedly has some possibility of working. we're told by the Pentagon that it successfully shot down a satellite and that it successfully shot down an incoming ICBM warhead in recent tests. It is deployed in Romania on the Russian border. It's supposedly has been deployed, or the deployment is being turned on green light at any moment in Poland, near the Russian border. Russia, that's one of the many reasons why Russia invaded Ukraine. It's not just because of the expansion of NATO. It's also the configuration and the expansion of NATO forces, including these SM-3 anti-missile missiles on the Russian border. That's just a little footnote to what, I can't say that without noting that Obama pulled the Tomahawk cruise missiles, subsonic cruise missiles, off of our patrolling aircraft in 2013. They were tipped with nuclear warheads. The Raytheon's Tomahawk missile normally, we just have used them with conventional warheads, but they were flying with nuclear warheads. They were pulled in 2013, but there's no evidence that the warheads were destroyed. And it so happens that those missiles fit in the same tubes that the SM-3s fit into in Poland and Romania. And once you have the infrastructure there, you can easily smuggle in nuclear-tipped Tomahawks and put them in the same launch tubes as the anti-missile missiles are supposed to be in. And Russia is quite aware of this. That's one of the many reasons why they are fearful.
Okay, thank you, Richard. We have one more question from Dorothy Weitzman.
Hi, is this how long has this new, and is it correct to say this is the new generation of nuclear weapons? It's that's a term that's used, and how long has it been in effect, and how are the quantities known? I mean, we saw this map earlier, the quantities of weapons. Are these included in those quantity listings? But that's it. Thank you.
Thank you so much for that question. It's a very important question, and it goes to the nervous, jittery undertone of my talk in terms of this historical moment, and that is that this wide deployment of these brand new battlefield nuclear weapons has happened within the last 2 years. Some of it started in 2018, but almost all of it is within the last 2 years. That's when all these new fancy dialable warheads for battlefield use have been deployed, and everybody's been trained and all this kind of stuff. So it's brand new.
Both Soviets the Russians have it, and we have it both within those 2 years.
I don't know that much about the timetable of Russian deployments, but they do have these kinds of systems deployed. The one they really upped the US on was deploying and using the hypersonic attack missiles that they're using in Ukraine, while the US is still in development phase of any hypersonic missile.
Thank you, Richard. Elaine, do you have a quick comment?
I just wanted to ask Richard, I don't think you mean, but perhaps you do, that the SSBN class of nuclear submarine, the Ohio class submarines, what will in the new version be called Columbia class, you don't mean that all of their 3-story high missiles have now been replaced with these battlefield missiles, do you?
No. I think out of the 24 missiles on a Trident sub, probably one of them, at the most 2, would have the B-61-12, but each missile has 6 to 8 warheads that it can independently, precisely target. But there would be the maximum of 1 or 2 B-61-12 warheaded missiles. And I don't know the number of W-76-2 battlefield warhead missiles, but I assume it wouldn't be too many. All the rest, by the way, have a mixture of warheads that are either 6 times the size of the Hiroshima warhead or 90 times the size of the Hiroshima blast. That's the W-88, which is still out there on all of the Trident submarines. Yeah.
Well, thank you, Richard, and thank you all for the good questions. Now let's move on to our next speaker, who is David Boris. He's a member of Chicago Area Peace Action. In fact, he's the most recent past president of Chicago Area Peace Action. He's a co-convener of their foreign policy working group. And this group works on a variety of foreign policy issues, including nuclear disarmament, the Ukraine war, our deteriorating relationship with China, and moving resources away from weapons and toward people on the planet. And he'll speak to us about the provocation of new ICBMs. David?
Thanks, Robert. Thanks for the introduction and for asking me to speak a little bit on the destabilizing, overly costly, and dangerous new nuclear weapon, formerly known as the ground-based strategic deterrent, now formally named the Sentinel missile. It's being developed to replace the 444 existing Minuteman III ICBMs located in 400 silos in 4 Western states. Acknowledging the depth and knowledge already in this group, I want to begin with just a brief bit of nuclear proliferation history. And I want to begin with a reminder of the obligation that we committed to in 1968 when we signed the Non-Proliferation Treaty. The NPT is widely recognized as the original cornerstone of the global nuclear non-proliferation regime. And the treaty that this country vociferously advocated for primarily addresses the more than 180 non-nuclear nations as it sought to mitigate the threat of nuclear conflict. But if we're to truly address the threat of nuclear holocaust in the world, I think it's imperative to review the most important article in that treaty. It's the shortest article in the treaty. I'm referring to Article 6, and I'm going to quote it now. Each of the parties to the treaty undertakes to pursue negotiations in good faith on effective measures relating to cessation of the nuclear arms race at an early date and to nuclear disarmament, and on a treaty on general and complete disarmament under strict and effective international control. I don't think it's a stretch to recognize the deep hypocrisy of our behavior over the past 50 plus years since the NPT came into force in 1970. While we've certainly negotiated a number of nuclear arms treaties, some more impactful than others, we failed miserably to embrace the spirit of Article 6 and work to carve a path toward eventual abolition of these enormously dangerous weapons. And no action over the past 53 years is more hypocritical and more in conflict with the intent of the Non-Proliferation Treaty than the nuclear modernization undertaken during the Obama administration in 2010. The CBO estimate in 2017, just 6 years ago, for both maintenance of and modernization overall was $1.2 trillion over 30 years to completely revamp and upgrade all aspects of our nuclear weapons arsenal. But that was revised in 2021 to $634 billion over just the 10 years from 21 to 30, and again revised to $756 billion in the 10 years between 2023 and 2032. I mentioned this. That's a 20% increase in just 2 years in the projected costs. And the entire program is already now projected to cost nearly $2 trillion. And it's hard to believe we won't continue to see that estimate revised upward as the CBO revises those estimated costs every 2 years. We hardly need to fully extrapolate the future rising budget estimates to understand that the entire program itself is fiscally unsustainable without untenable drastic cuts to programs of social need. But more important, the question of cost of this modernization effort is not merely a fiscal conversation. Because we do not operate in a vacuum on the world stage, our nuclear armed adversaries certainly take notice of our proliferating activity with the modernization and have responded accordingly. Following our lead, Russia has increased its weapons development, and China, not wishing to be left out as an increasingly rising global superpower, has followed suit as well, seeking to grow its arsenal a whopping 370% over the next 12 years, from a present-day estimate of 410 weapons to a stockpile of nearly 1,500 by 2035. So it's becoming increasingly clear every passing month that U.S. nuclear modernization program has proven to be the single most destabilizing action perhaps ever in the entire history of nuclear weapons. And that is a cost that is as yet to be fully calculated. So I want to posit a different scenario built around actually reducing risk. Imagine the difference in world behavior if the U.S. nuclear posture ratcheted back significant portions of its nuclear weapons spending in preparation for a path towards signing the TPNW, the Treaty for Prohibition of Nuclear Weapons, understanding the practical political impossibility of beginning to dismantle the entire arsenal overnight. It certainly could be possible to show our long-term intent to, in the words of a Nobel Prize-winning past president, and I'll quote from 2009, to state, quote, clearly and with conviction, America's commitment to seek the peace and security of a world without nuclear weapons. First, the United States will take concrete steps toward a world without nuclear weapons. To put an end to Cold War thinking, we will reduce the role of nuclear weapons in our national security strategy and urge others to do the same. Even though we have moved since that soaring speech in April of 2009 at almost light speed in the opposite direction, if we were to want to make good on the promise of such a world for our children and grandchildren to inherit, what might be the very first step we are able to take? I submit that the first step is to frame a narrative around the complete lack of necessity to spend. By the way, now the projected cost for those 644 ICBMs is about $100 billion over 10 years to manufacture 634 Sentinel missiles to completely replace the Minuteman III missile force, our entire land-based force of ICBMs. And in framing that argument against such wasteful spending, we must naturally call into question the efficacy of the very existence of land-based ICBMs, calling them out as dangerous, destabilizing, and unnecessary. Because even if you are of a belief that nuclear weapons are necessary in the short term to act as a deterrent to other nuclear armed adversaries, a duopoly of sea and air-based weapons systems fill that purpose many times over. The problem with land-based weapons in silos is their very fixed-in-place status makes them extremely vulnerable to attack and thus most likely to be fired by miscalculation or accident in an effort to use them before they are destroyed by an incoming attack. Indeed, the United States military calls the land-based leg the nuclear sponge. It's really there just to soak up incoming land-based ICBMs from our adversaries. This cultural mindset of use them or lose them depreciates the single most valuable resource we have in avoiding catastrophic nuclear conflagration: time. The inability to get safely out of harm's way reduces the time frame for decision-making to almost zero, reducing this leg of the system to irrelevance if we're talking about deterrence. And of course, the presence of non-recallable ICBMs on hair trigger alert in the United States almost de facto guarantees that Russian and Chinese arsenals are deployed in the same manner. And that fact exponentially increases the possibility of a nuclear exchange by miscalculation or accident. Robert McNamara reminds us in the very beginning of his famous movie, The Fog of War, when it comes to the application of military force, every commander will tell you that in war mistakes are made, and these mistakes cost lives, whether it is your troops or the troops on the other side. sometimes costing hundreds of lives, sometimes thousands of lives, sometimes tens of thousands. And we all hope to never make the same mistake twice. But maybe we make the same mistake a second time or a third time, but then not a fourth time. McNamara goes on to say, with nuclear weapons, there isn't the luxury of a learning curve. You make one mistake, you're going to destroy nations. You do not get a second chance to fix a mistake with nuclear war. So I'll conclude with a quick summation of the main arguments as I see them against the building of the new Sentinel missile, which, by the way, is not scheduled to be beginning to be deployed until 2029. There is time. The cost in dollars is already far too high and still unknown for the security they are supposed to provide, which is minimal. The very existence of the US program is acting as a destabilizing catalyst for a new nuclear arms race, except this time we're engaged in a trilateral arms race, not bilateral, exponentially increasing the cost and the risk of miscalculation or accidental detonation. The program increases sunk cost into the most destabilizing and vulnerable part of the nuclear weapons architecture, moving us further from the goal of removing the Damoclean sword under which we have lived by luck and the grace of God for the past 78 years. That grace will expire one day, and woe be to us for not having acted when we could. Finally, the removal of the land-based triad, the land-based leg of the triad, is the most likely entry point to signal to the world that the US indeed intends to live up to its obligations under the NPT and to own the soaring rhetoric expressed by Barack Obama in 2009. Thank you.
Thank you, David. I see a hand up from Robin Harper.
Yeah, I wondered why there's no talk about the dangerous personalities, the sociopaths, etc., like Putin and Xi and Trump, and the leaders of most of the weapons companies who think that they deserve all this power and glory, and are putting terrible pressure on the Democrats that are afraid of them, and why the UN can't be strengthened to work with all these non-nuclear countries to put pressure on the nuke countries to get on a timetable to ban all nuclear weapons. And I think that could be done, but you got to talk about these sociopaths' personalities and drive this stuff.
Well, first of all, I think the TPNW is exactly that. It's an effort by the non-nuclear nations of the world to put into place something that they felt built on the basis of the NPT and was actually stronger than the NPT because it makes it a crime against the world to own, manufacture, or I don't have the exact language in the TPNW, but we all know kind of what that stands for. And I would submit that there are always going to be sociopaths, Robin. I think the problem is that in the past, sociopaths had divisions and tanks and some sort of weapons, but the fact that the weapons that can destroy all life on Earth. By the way, Daniel Ellsberg does suggest that the nuclear exchange and the following nuclear winter probably won't destroy all life on Earth. He thinks 7 to 10% of the Earth's population might survive. But I think it's the weapons themselves rather than the individuals. But I understand your point. If we're looking to find the place to make people understand the real fear that they should have. But, one person's sociopath is somebody else's cultural hero.
Okay, thank you. Any other quick questions before we move to the fourth? I don't see any, so thank you, David. Our fourth panelist, unfortunately, cannot be here in person. It's Representative James McGovern, who represents the 2nd District in Massachusetts in Congress. He has done that since 1997, actually. And the 2nd District is basically Worcester to the Pioneer Valley. He is the ranking member of the House Rules Committee, and he has recently introduced what's called House Resolution 77, the Back from the Brink resolution. It was introduced in January of this year. And he, in general, is a very important advocate in Congress for nuclear disarmament. So what we do have is a video that Representative McGovern sent, his comments on the U.S. House back from the brink resolution. And I believe Cole's going to play that now.
Hi, everybody. I'm Congressman Jim McGovern, and I represent the 2nd Congressional District of Massachusetts. Just a brief drive to the west. I'm very honored to have been invited to participate in today's forum, where we will learn from such a wealth of expertise. I only wish that I could be with you in person, but unfortunately my schedule just wouldn't allow for it. I'm particularly disappointed because I can't think of a time when I've been introduced by a physicist who teaches at MIT. So thank you, Bob, for your kind words. You know, I've been around Washington long enough, first as a congressional aide to Congressman Joe Moakley of South Boston, and then as a member of Congress from Central and Western Massachusetts since 1997, to remember when doubling the NIH budget was a bipartisan common cause. We achieved that goal under Democratic and Republican presidents during my first few years as a member of Congress. I can even remember when it was possible for members of Congress to offer an amendment shifting funds from the defense budget to domestic priorities, especially our nation's health, education, and poverty alleviation programs. Those debates helped our constituents and our colleagues focus on defining and debating what is truly in the interest of our nation, our people, and our communities. I miss those debates. I firmly believe that the budget, and I include not just the budget resolution, which hardly comes up anymore, but also the individual appropriations bills and the president's annual budget, are moral documents. So I am very grateful for today's forum that places a premium on our nation's health versus the destructive capacity of our nuclear arsenal. At the end of January, Congressman Earl Blumenauer from Oregon and I introduced a resolution called HRES 77. It calls on the federal government and the American people to work towards reducing and ultimately eliminating nuclear weapons, actively pursuing and concluding negotiations on arms control agreements, taking our nuclear weapons off high alert, and canceling the $1 trillion program to upgrade and modernize the U.S. nuclear arsenal. It also calls on the President and the Secretaries of State and Defense to embrace the goals and provisions of the Treaty on the Prohibition of Nuclear Weapons, which calls for the elimination of all nuclear weapons. As most of you know, that treaty was signed by 122 nations at the United Nations on July 7, 2017. It is the first ever legally binding international agreement to prohibit and eliminate all nuclear weapons, and it entered into force on January 22nd, 2021. And sadly, the United States is not a party. Look, the world made real progress towards peace in the last century, due in no small measure to an incredible grassroots movement here in the United States and globally. Many of you have been longtime peace activists in that movement. Many of you have contributed your time and expertise in researching and analyzing the consequences of nuclear war. You know, recently I went to the movies with my family and we saw Oppenheimer. I can't imagine a better film to start a discussion about how nuclear weapons keep us tethered to a dark and dangerous past. But now it's time to continue that conversation and use this momentum to start a real push towards nuclear abolition. As Russia has shown by its invasion of Ukraine, even the threat of nuclear weapons remains a potent weapon that allows war and aggression to happen with impunity. Belarus has welcomed Russian nuclear weapons on its soil. The president of Belarus announced that there are nuclear weapons for everyone who will join the Russian-Belarus alliance. North Korea is continuing to test missile launches. Iran is close to having enough weapons-grade uranium to build a nuclear weapon, and sadly, you know, we withdrew from the conversations and the negotiations with Iran on prohibiting Iran from getting a nuclear weapon. And U.S., Russia, and China are modernizing and expanding their nuclear arsenals. Since 2019, the U.S. and Russia have withdrawn from several nuclear arms agreements, opening the door to a new arms race. We need to hit the brakes and throw this car in reverse now, not tomorrow or the day after. If people don't re-engage on stopping the nuclear buildup and proliferation of weapons, we can toss the doomsday clock out the window because doomsday will be here. But look, I'm an optimist. I know we can make a difference today because we've all made a difference before. Today's forum is proof of that. And I love that today's forum is not just about the expense and horror of maintaining our nuclear arsenal. It's about the amazing benefits to the American people and the world if expenditures on nuclear weapons were reduced and used to strengthen and expand our country's health. I believe HRES 77 is one way we can educate and mobilize our friends and neighbors, our cities, towns, and states, so we can reverse the madness. I think this resolution can help frame the debate, perhaps not in this Congress, but hopefully in the next, to get back to the negotiation table and work towards a prohibition on the use of nuclear weapons and ultimately their elimination. Right now, HRES 77 has 39 co-sponsors from all corners of the United States. Already, that's more than 3 times the number of co-sponsors we had in the last Congress. We can continue to build on that momentum. We can continue to involve more and more people in this movement and ask them to get their members of Congress on board. HRES 77 was born out of a grassroots movement, back from the brink, and from conversations with my good friend Ira Helfand. Massachusetts Peace Action has taken up this cause and moved the ball forward on several fronts here in Massachusetts. Out of such basic building blocks, much like atoms colliding, we can change the course of our nation. I really believe this, and the treaty proves that. I'm so grateful to be able to play a small role in your work, your research, and your campaigns. And please know that I will continue to be wind at your back. You are on the right side of history, and we need to move forward and we need to abolish nuclear weapons. Thank you.
Thank you. That was quite a remarkable video. If you want to ask questions of Representative McGovern, you're going to have to speak very loudly because he doesn't hear them. But there may be some comments that people want to make specifically about this. Robin, your hand is down now. I see. How about Louise? You're muted, Louise.
Better, huh?
Yes.
No, I was thinking about how Jim McGovern mentioned the Oppenheimer movie, and I was wondering if anybody on the panel has any observations or anything about how we can utilize that. It's a real opportunity, and it seems like people's, for want of a better phrase, psychic numbing is lessening, or Oppenheimer is helping, but it just seems like there is more of a somewhat more of an awareness. So I was just curious if the panelists, anybody want to talk about that.
Any comments from the panel? Elaine?
Well, I think I agree with you. I think the Oppenheimer film has brought about a sea change. It's been seen by everybody, at least everybody I've spoken with, and the numbers suggest it really is a huge number. I think that it's really advanced the awakening, far beyond any other single event in recent years. People sometimes fault it for leaving out this or leaving out that. It can't do everything, but what it does is really remarkable. There are very few artworks that actually change history. One of the very few is Uncle Tom's Cabin, the novel that Lincoln said started the Civil War, and quite accurately. There are a couple of others. I don't know if this is quite on that scale, but it remains to be seen what happens this year, whether people's attention remains focused on this. Because though it is mainly about the past, the conclusion of that film, where he makes it clear that a chain reaction is not just something that happens in a millisecond. It's something that can happen over 78 years. We're in a chain reaction right now. And whether we can actually stop it from reaching its conclusion remains to be seen. It'll be, a triumph if we can. But I think we have to keep the conversation going at, I think particularly at schools, because young people love Christopher Nolan. They don't ordinarily love nuclear disarmament, but they love Christopher Nolan and they're listening. Therefore, I think this is the moment where something really could change.
Elaine, has there been any other any updates on Christopher Nolan coming to visit Harvard?
So far, that hasn't been successful.
Okay.
Not surprising, but his agents, has said that she will remain in touch with us.
We'll see what we can do on that one as well. Oh,
with
yeah.
the actors strike, going on,
That's right.
it makes it hard for people to come forward. One of the actors in the film, Matt Damon, was an undergraduate here, so often returns, but issuing invitations at this moment to actors isn't.
Right. It's true. That's true. Okay.
Concerning the Oppenheimer film, maybe I can just comment briefly as a nuclear scientist. I've seen it, and I've talked to a number of my friends who, work in nuclear science, including some at Los Alamos. And in general, the reaction I've heard is very positive, both in terms of its veracity and it's addressing the important issues, as well as going forward. They indeed hope that it can be used to get more attention to these issues.
And one other last thing is that Mass Peace Action is going to have, I think it's this coming Wednesday. Susan Mirsky and some other people are having a webinar on psychic numbing or public disengagement. So that's this coming week. And the Nuclear Disarmament and Public Education Group is also planning a webinar on that subject. It finally seems as though we do have people's attention, at least somewhat more, and it's a great opportunity.
Yeah, I agree. Jonathan, I think I'll turn it back to you at this point.
Well, I just want to thank everybody, all the chairs, all the speakers. I think Rep. McGovern was as uplifting as one could ask for. We'll be in touch with everybody who registers for this. You'll get the link to the video, and we will keep in touch with you on further developments. And if we can get a campaign going to stop the Sentinel missile, that would be one step in the right direction. And of course, general support for the Back from the Brink resolution. So with that, I would wish you all a good evening. Thank you all, and let's stay the course.
And thank you, Jonathan.
Thanks, Jonathan.
Thanks, Jonathan.
Thanks, everybody.
Thank you so much.